curable bladder disease. All righty. Hello, YouTube. So I do these meetings usually almost every Sunday of the month, usually starting between 12:30 and 1 o'clock Pacific time. We simulcast live on Facebook and YouTube. If I'm looking up here, I'm looking at Facebook. If I'm looking down here, I am looking at YouTube. Every patient is welcome. Every family member is welcome. Any community member is welcome. Whoops. This is all about information. Hello, Lisa. Hello, Ruth. Thank you, Ruth. I love to sing. Sometimes I'm okay. Sometimes I'm not okay at it. Now, I know that it's the holidays and people are doing all sorts of other things, getting ready for it. Hello, everybody on YouTube. It's nice to see you. We've got a couple people over there. We'll give it a couple of minutes to let people come on in. Peg, absolutely. So much help. Hello, Laura. It's very nice to see you. How are you doing today? How are you feeling today, Lisa? Ruth, how about you? How are you guys doing? Hello, my sister Donna. How are you doing today, hon? Life, right? So, y'all remember last week, if you were at my last meeting, that I kept saying that my front tooth hurt? Well, I've broken both of my front teeth. You can't see. I fractured them first, like 30 years ago on a Tootsie Pop, which is why they're crooked. And now I have to have 2 root canals and 2 crowns on the 15th. And they're not happy. That's not terrible. I can talk, but anyway, it's not happy. Hello, Deb. It's nice to see you. Hello, Crescenda. Laura says her lower back aches with your IC. So anytime really the lower back is hurting with your IC, we're really looking at your pelvic floor muscles. We want to see how your pelvic floor muscles are. Hello, Kim. Nice to see you. Hello, Carolyn. Ashley, first timer. Yeah. Welcome, hun. You are not alone. Tabitha says, hi, Jill. I have IC and PFD. I'm in physical therapy, but I still struggle so much with the left side of my pelvic floor. Girl, me too. I don't know. If you're right-handed, usually it's the left side that's bothering you. If you're left-handed, usually it's the right side that's bothering you. I still struggle so much with the left side of my pelvic floor that seems to be tight and kind of swells. It gives me frequency urgency. Well, Tabitha, we have to really look at mechanical forces. Is there anything structural on your left side that is keeping your pelvic floor tight? A bad hip, a bad SI joint like I have? Are you not walking correctly? Anytime somebody has long-term chronic muscle tension, we're always going to be looking at bony structures to try to understand what could be putting stress on those muscles. A big research study came out this summer, and it was very, very important because it showed that 70% of the men struggling with testicular pain had an underlying orthopedic hip disorder. And so getting these patients over to orthopedics so that they can address the hip issue and get the hips corrected, it was vital to reducing their pain. Hello, Carolyn. Nice to see you. Hi, Haggy. Nice to see you. Stress is real. Stress is real right now. All right. So normally the way I do these meetings is I do kind of a 30-minute, Tabitha here says she's got a shorter leg. I have the book on pelvic pain, also constipation. All right. So the fact that you've got a shorter leg is important. And so we really have to ask the question then, would a lift in your shoe that would even out your hips help? Probably. It's hard though, because your body's compensated for it a long time. That makes it challenging. But the fact of the matter is, as long as you've got one hip that's off, your muscles, your pelvic, your hips are not going to be functioning normally together. And you can see how that would immediately put strain and stress and extra torsion on those muscles. Carolyn says she has a painful ankle on my right, bad knees, hips. Right. Okay. So understand that when you're walking, remember, the pelvis is the center of the human body. It's the core of the human body. It carries the weight of your torso. It's what helps you move, right? It attaches things together, but it also deflects the stresses up your legs from when you walk. And so if you stumble, or if you're in a rear end collision and you go like this, right? That pressure is going to come right back into your pelvis. That's why people who are in car accidents often end up with pelvic floor issues, because they don't necessarily understand how I mean, if your legs are out and you're driving and you rear end somebody, right? Out like this on the accelerator or on the brake, all that pressure is going to come right up your leg, right up into your pelvis. It's big. Kelly says let's see. Carolyn says she's got a painful ankle on your right, bad knees, hips. Yep. Okay, so we got to try to work on those. Kelly says, that's how I am, right-handed, left side of my pelvis, down there, it hurts. You know, guys, so like when I was in high school and college, a pretty good tennis player. I actually played pro a little bit. Wrong sport for a redhead. Had skin cancer within a couple years, but I was pretty good at it. And the thing that was interesting, so like when you play tennis, right? So here's my racket. You're going to step in on your left side and you're going to swing like this, right? That's a good tennis stroke, is like this. But think about it. All my weight is on my left hip. And then what am I doing? I'm rotating it. And SI issues in particular are very common among tennis players, racket sports players. My physical therapist was the same physical therapist that Yvonne Lendl had, and he had the exact same thing I have. And it's a beast to deal with. It's an absolute beast to deal with. Carolyn has osteoporosis and fibroids. So we got to think about those fibroids, because if those fibroids are continuing to put pressure on your bladder, direct pressure on your bladder, that could explain your symptoms. And we had another really good research study that showed that if the fibroids were removed or lessened, so they weren't putting pressure on the bladder symptoms usually went away. So think about that. Think about that. Okay, so I have something here. I am writing our fall winter magazine. Obviously, we're late with our fall magazine because of all the fires. Oh, and Joy of Joys, we're going to another fire alert tonight at 11. But we've already burned, so I'm not going to burn again. We've already burned here, but that doesn't mean that other people can't. Okay. So our fall winter magazine, give me a big double issue. Got to finish it up next week because I got to have a root canal after that. Is all about chronic overlapping pain conditions. And it's so interesting. It's so fascinating. Why do IC patients have IBS, vulvodynia, irritable bowel, TMJ? There is a significant group of IC patients who have these related conditions. I got most of them in my 20s. And so in October, I attended a 3-weekend long seminar, conference by the International Pelvic Pain Society. And they were talking very specifically about chronic overlapping pain conditions. And so remember, we subtype patients now. Every patient is a snowflake. Y'all are not the same. You are not the same. There's tremendous diversity in this patient population. For some of you, IC began in childhood. For others, IC began after menopause. Are you the same? No. For some of you, IC began after having a baby, or if you fell. For others, IC began after chemotherapy. Are you the same? No. We have tremendous respect now for the fact that there is diversity. And it's going to surprise a lot of you when I say we don't even think of IC as an incurable bladder disease. And we haven't since 2008. Why? Because in 2008, the first pelvic floor physical therapy study came out from the National Institutes of Health, which proved beyond a shadow of a doubt that muscle therapy resolved the symptoms in many, if not most patients. And it was at that moment that the IC world got turned on its head, because up to that point, everybody's going bladder. And it's like, no, now we're going muscle, and a little bit about bladder, a lot of muscle. But neither one of those explain chronic overlapping pain conditions. And there is this fabulous research alliance that's been going on for 15 years now that is studying it. And now we understand why chronic overlapping pain conditions happen. And it's all about the brain. Now, it's not a mental illness, I'm not saying that at all. It's about your central nervous system. And so, let's see. I want to, think about your brain for a moment. Your brain's purpose is to hold memories. Your brain's purpose is to protect you. Your brain's purpose is to provide context. Think about the fight or flight response, right? If you 5,000 years ago, when your ancestors were running from saber-toothed tigers, right? There's memory here. Your brain is a very dynamic organism. And Sarah says, is there a doctor? Possibly. So just let me get through this. So the purpose of your brain is to save your life. And it saves your life by reacting to stimuli. If it sees a saber-toothed tiger, you're going to be startled. You're going to go, uh-oh. Your brain is going to cause a whole cascade of reactions to happen, including blood flow gets changed. Blood flow gets directed to from your torso to your legs and to your arms so that you can run or fight, right? But remember, too, that as we go older, there is memory. I mean, that's really what makes us human in a way. But any mammal has memory. But we really have memory. I mean, think back about what's the earliest memory you have? What's the earliest memory you have? I'm 60 years old. My earliest memory is that my pillow smelled like maple syrup. And I think it was like, no, actually, it's earlier than that. It's earlier than that. I think I was like 2 years old, and we were in Santa Barbara, living there on the coast, and a helicopter got stuck in the fog and was circling over my neighborhood, getting lower and lower and lower. Apparently, I was terrified. And that is a trigger for me 58 years later. I have dreamed about planes crashing for 58 years. And it was a palpable, terrifying memory. My mother remembers me screaming that I was screaming about it. So when we think about the purpose of memory, it is to help us remember things that could hurt us. It's to help us to remember the things that are good. It's to help us remember where there's good food, water. Think about migrating herds of elephants. They go from water hole to water hole. Memory is real. And what's even more interesting is in some cases, memory is transferred through generations. I think in migrating fish and migrating birds, how does a baby bird know it's supposed to go this way? Is it memory or is it a magnetic thing? I don't know. But anyway, memory is palpable. 58 years later, I still hear and can imagine and see it and remember this plane or this helicopter almost crashing into my house. So let's getting back to chronic overlapping pain conditions. In brain studies, what we find is a brain under stress and stress. It is a brain that has been stressed. It is a brain that is in chronic stress. And that kind of makes sense for 2020 because, hello, we are all living in a terrible stress right now. Just taking a walk is scary at this point in time. God forbid somebody run up behind you without a mask running, and you have to breathe their air. So between COVID and between IC and between the fires and environmental things, believe me, we are under massive stress right now. And that is reflected in how our brain functions because our brain's purpose is to interpret that stress and protect us. But there comes a point where if that stress is intense or that pain is intense, it kind of becomes a memorized transaction, number one. And number two, it leaves your brain. See, look at that. Fire alert, fire alert warning right across my screen. Hello, stress. So in brain studies, again, with people with chronic overlapping pain conditions, including IC, what we see is a brain that's living in stress right now. And that it's become a maladaptive process. Chris, hold that thought. I would be happy to talk about ureaplasma and mycoplasma. The other way we can confirm that is in the level of anxiety that patients with chronic overlapping pain conditions has, right? I mean, if you're catastrophizing means that every thought you have is going to be a catastrophe. It's like, I'm going to have COVID by Christmas, or a fire is going to burn my house. Literally everything going through your brain is a scary thought. And with every scary thought, you are introducing adrenaline into your bloodstream, which is just winding up your nervous system even more, massively. And for some of us, it's scary thought, scary thought, scary thought, scary thought, adrenaline, 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 adrenaline. And before you know it, you got 200 shots of adrenaline going through your body. And of course you're scared. And of course your heart rate's up. And of course you're sweating. And of course you want to flee or flight. The fight or flight system wasn't designed for life in 2020. The fight or flight response was really designed for life with saber-toothed tigers. And we have a lot of stress that's triggering a lot of adrenaline, which is winding up our nervous system, which is changing the way our brain is functioning. Our entire central nervous system changes. And the way it changes is it just becomes more sensitive. The pain becomes easier to turn on. You put 100 cc's, you put 1,000 cc's of water in somebody who doesn't have central sensitization or chronic overlapping pain, they can walk around for hours. They're fine. You put 100 cc's of water in my bladder, and my bladder is perfectly healthy. There's not a damn thing wrong with my bladder. You look at it, it's like a baby bladder. But you put 100 cc's of fluid in my bladder, I got to pay. Why? Because I have a more sensitive nervous system. I see subtype 5 central sensitization. And so the purpose in me talking to you about this is that we have, Robin says here, trauma can imprint on your cells. Yeah. Think about somebody who is a victim of child abuse. It's incomprehensible that it happened in the first place, because every child should be loved and nurtured and adored and cared for and protected. But they've even found it in babies who have had to go into the NICU for a couple of days or a couple of weeks or a couple of months, where they're not getting the love and the holding and the sense of smell and all that sort of thing that you would normally get from your mother. Even babies can be born with a more sensitive nervous system and memory, this kind of distinct memory that's stored in their brain. So we're talking nervous system wind up. Man, that nervous system is wound up and is on a hair trigger. And every single time you have a negative thought, bam, you wind it up even more. And every time you drink caffeine, bam, you wind it up even more. And as long as your nervous system is wound up, you're going to be feeling a lot more pain. We know that pain accompanied by anxiety will always be intensified. Pain accompanied by laughter will be minimized, but that's part of the brain's pain response. So how do we, or can we, change our central nervous system? And the answer is yeah. And we can change our brain. Yeah, absolutely. We can. Think about somebody who's had a stroke. Okay, part of their brain might be damaged, but through a concept called neuroplasticity, the brain responds to that damage and compensates for that damage. We can calm our nervous system down. We can wind down our nervous system. We can wind down our nervous system. But so how do we do that? Now, y'all know that there's guided relaxation. We've got it on our website. We've got proof. We have research studies that prove that if you do guided relaxation every day, your pain will get better. Why? Because it's calming the nervous system down. But I was reading there's a wonderful therapist who specializes in IC and chronic overlapping pain. Her name is Alexandra Millspa, and I was re-listening to all of her lectures, and I wanted to do one of these with you. So how? I mean, it's just so interesting. So I want to prove that we can calm our central nervous system down. And we're going to do it with a 5-minute game, 5-minute mindfulness exercise that's called I Spy. And so let's see. So what we're going to try to do is we're going to try to engage different portions of your brain. That's all we're going to try to do. So we're going to try to deactivate the portion that's focused on your bladder, and we're going to turn on portions of your brain to get them to compensate for that. Okay, so we're just going to try to restore a little bit of normal brain function. So this is called I Spy. So first of all, I want you all just get as comfortable as you can. Like get super okay, am I comfortable? Yes, I'm comfortable. All right. Okay. Take a look around you. We're going to do the eyes first. Take a look around you and look at your room or look at the screen. What do you see? Look at my background. What do you see? And take a nice, slow, deep breath in, out. Okay. And our breathe out is going to be a little bit longer than our breathe in. Okay. Now, close your eyes. What do you hear? Breathe in. Breathe out. All right. Close your eyes. What do you smell? Hand lotion. Breathe in. Breathe out. Close your eyes. What do you taste? Carrot muffins. Breathe in. Breathe out. Close your eyes. What do you feel? Are you happy? Are you sad? What are you feeling? I don't know what I'm feeling right now. That's a hard question. I do not know what I'm feeling right now. I mean, I'm really happy to be here. Okay, breathe in. Breathe out. Now, what that's done is that's activated your 5 senses. And, you know, the brain fires like a thunderstorm. If you've ever flown over a thunderstorm, you see the lightning is in all sorts of different clouds, right? Well, that's what the brain looks like. There's lots of different areas of the brain firing at any given time. And so what we're trying to do is center the brain on the 5 core fundamental senses that will create balance. So that's called I Spy. Now let's do it another one. I'm going to do another one. Close your eyes. Fill this in. I smile when I see, fill it in. I smile when I see a butterfly. Breathe in. Breathe out. Close your eyes. I smile when I smell blank. Fill it in. I smile when I smell maple syrup. Breathe in. Breathe out. Okay. Close your eyes. I smile when I taste a hot cinnamon roll. Breathe in. Breathe out. I smile when I feel, fill in the blank. I smile when I feel the sun on my face. In, out. So mindfulness, any good pain management program, and you know, a lot of you have pain. I know you do because I had pain too. Mindfulness is the single most effective thing that you can do to try to calm your nervous system down. And what it does, Donna says, this experience is euphoric. Awesome. So what mindfulness does is it gets you to redirect your brain to something that's happening right now. So when you're being mindful, you're not thinking about the root canal in 15 days or 10 days. You're not thinking about the kid who bullied you. You're thinking about, I am sitting right now talking with a bunch of people who share my life, who share my journey, who I appreciate tremendously. And sometimes when you're in pain, it's even more than that. It's just like, it's about petting your dog or your cat and enjoying the feeling of it. Or it's about just stopping and smelling a rose, or it's about listening. Music is amazing. Music, you know, musicians grow up with completely different brains anyway. It's amazing what music does. I'm going to ask for a guitar for Christmas because I want to start playing guitar again. And it's just about, as Donna says here on YouTube, being in the moment. Now, the research is stunning. The research is so good that patients with chronic overlapping pain conditions, when we calm the nervous system, when we wind down the nervous system, what happens? Your pain improves dramatically, because pain that is accompanied by anxiety will be intensified. If we can get that brain not anxious, things do better. You will do better. I want to try one other. Let's just try one other, and then I'll get to your questions. The following breathing exercise gently guide the autonomic nervous system back into the resting state. By practicing these techniques on a daily basis, you not only increase the relaxation response in your body, but you create new habitual patterns of breathing on a regular basis. When the nervous system is habituated to be in the relaxation response, you will decrease your symptoms of fear, anxiety, depression, and most importantly, chronic pain. The relaxation response also increases the body's natural healing response, that you heal when you're relaxed. It's very hard to heal when you're stressed. All right. So we're gonna do the bumblebee. I'm gonna be stupid with this, so just bear with me, but in a funny way. This is all meant to be funny. Okay. So with the bumblebee breath, you inhale through your nose, and then you exhale and you make a sound like a bee, a buzzing bee. So we're gonna go in, and we're gonna go. Oh, I can't even do it. Oh my God. Let's see. In, and then okay. We're gonna do it 5 times. In, out. In, out. Now she also says you could sing, so we can go in. We wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas and a Happy New Year. Okay, there we go. One more time. In. Good tidings we bring to you and your kin. Good tidings at Christmas and a Happy New Year. Right? So the out breath is longer than the in breath. And when you sing like that, it's amazing the relaxation that came right over my body when I did that. Right. And so, um, what I want you to understand here is that nobody, no one is saying that IC is all in your head. Nobody is saying that you are mentally ill. Nobody is saying this is a mental illness. What they're saying is that your central nervous system is wound up through trauma. And in the convention or the conference that I went to, the most important class was a pediatric risk factor class. Because what they found is that in the year before it began, that child experienced a trauma of some type. A fall, breaking your tailbone, something like that. Or it could be bullying. Bullying is a classic issue. It is one of the biggest risk factors for somebody with chronic overlapping pain conditions is going through a period of extended bullying, which is, I mean, I had a rapist murderer living in my neighborhood when I was in elementary school. You want to talk extreme stress? I was afraid to walk to school for years. And I was a freaking kid. That shaped my life. That shaped my responses to a lot of different things. And now I am finally understanding what I have to do to, number one, not blame myself because none of it was my fault in any way, shape, or form, but understand kind of the consequences of that on my body and that my brain remembers that. I remember that. I will never forget going through that. But I've got to restore, you have to process it. We don't want to ruminate on it. Ruminating is when you think about something over and over and over again. Listen, the past is past. It's over. It's done. We can't do a damn thing about it. What we have control of right now is today. We have to focus on today. What can we do right now to put our bladders and our bodies in a better position? It doesn't help to think about the doctor who mistreated you. It doesn't help to think about the family member who bullied you. It doesn't help. It's over. It's done. Let it go. It's done. But you and I have power today to create an environment that will support our body's healing. And that comes with doing whatever therapy our doctor needs to do. It comes with modifying our diet so that we're eating good. Your nervous system needs a good, healthy, fresh diet to function normally. It needs water to function normally. And it's about embracing the power we have today at this moment. And it's about not getting lost in worry and fear. It's about faith. It's about, I can do all things through Christ or whichever your faith is that strengthens me. I will get through this. You will get through this. So anyway, I just wanted to try those with you. We're going to be I'm going to be going in depth into this into our next magazine, because I think it's another giant missing piece of the puzzle. And I mean, I'll be really honest. I got pissed off when my doctor told me I needed to practice mindfulness. It's like, shut the F up. My bladder is screaming. I do not need to go to a therapist and whatever. Help me with this bladder pain. I am up all night peeing. I didn't understand that 27 years ago. I understand that now. I didn't understand that anxiety causes pain to worsen. And I think the single most important thing that I did is I took an anxiety management class 20 years ago. So my anxiety is just, I don't panic anymore. I know what to do. I know the power of a thought, and I know that my job is to keep my adrenaline levels as low as possible, and I do that with deep breathing. All right. So Dawn says, it's wonderful talking with you the other day. Thank you again. Oh, you're welcome, Dawn. Carla says, music touches me like nothing else is pure emotion. Pam's physical therapist says she doesn't breathe correctly. Marcella says, I'm going to my physical therapy appointment on Tuesday. So nervous. Oh, Marcella, don't be nervous. This is cool. Are you kidding? This is exciting. This is exciting because, now you're going to have really good, clear information. You're going to have facts. No more guessing. You're going to have facts. You get to go into that physical therapy appointment, and you are an anatomical mystery to be solved. Your goal is to walk in and describe. Don't say you have IC, for God's sake. Don't walk in and say you've got IC. You need to walk in and talk about your symptoms. Hey, doctor, I have pain on my left side, or I have pain on my right side, or I've got tingling pain or burning pain, or I got pain in my back. Describe the pain, where it is. Describe what it feels like. What makes it better? What makes it worse? And it's their job to study your pelvis. And so they're going to measure your legs. They'll see if you've got one leg longer than the other. They're going to have you walk up and down a hallway. They should see how you're walking. They're going to look at your core, your back, your legs, your hips. And then they're going to do a brief internal examination. And that's the most important part of it. And so you're not in stirrups. There's no speculum involved. All they're going to do is with it obviously gloved and a little bit of lubrication, they're going to stick their finger in your vagina and they're just going to touch muscles. And I'm going to show you what they do. Here, hold on. Oh, I forgot to turn my love sign on. There you go. So let me get my handy dandy model here. Oh, for God's sake, I just dropped my bowel. Vulva, bladder, gone. Okay, so look. So here's your these are your pelvic floor muscles, right? And so they're going to be sticking their finger in your vagina, and all they're going to do is touch muscle groups. See, it's so hard to demonstrate this reverse. So they're going to be touching in the front. And they're going to be able to go all the way by your hip bone. They're going to be able to touch that, which is really interesting. These are your piriformis muscles, your piriformis and your obturator muscles. So they're going to touch shallow muscles and they're going to touch deep muscles, right? And if they can trigger your pain, that is a hallelujah moment. That is so exciting because they found it. They found it. If they can touch a muscle and trigger your pain, that is a hallelujah moment. And your job is, okay, that's it. What are you touching? And your goal is to walk out of that meeting knowing the name of the muscle, the names of the muscles. Is it your levator ani? There's a lot of different muscle groups in the levator ani. The levator ani are the shallow muscles. These are right on the surface, right? So here are your levator ani muscles. So these are the muscles that go from front to back, from your pubic bone to your tailbone. And you can see that there are 3 holes in these muscles, one for your rectum, one for your vagina, one for your urethra. And if these muscles are tight, what's going to happen? They're going to be squeezing the urethra. They're going to be squeezing the vagina and the rectum. You're going to have constipation. You're going to have difficulty starting your urine stream. And yeah, it's going to be hard to have sex because if your muscles are tight, If it's hard to let something out, it's going to be really hard to let something back inside, right? So I'm really excited for you that you're going to have, Marcella, your pelvic floor physical therapy appointment. That's awesome. Vicky says she feels depressed and trapped. All right. If you were on the phone with me right now, Vicky, let's see. How do I want to? It's normal to be upset when you've got pain. It's normal to be depressed if you're not getting answers. It's normal to be angry when somebody isn't treating you well or a treatment isn't working. Those are completely justifiable responses to having something that is difficult, like bladder pain or pelvic pain or IC. But there are other things that can contribute to that. If you are of a certain age, from being perimenopausal to being postmenopausal, understand that the loss of estrogen is going to exacerbate depression. It is going to exacerbate anxiety and frustration. And so I would want to take, I think it's important that you tell your doctor that you're struggling. It's important that, especially your OBGYN, tell them that you're feeling very depressed. And consider the fact and ask them if aging could be playing a role in that, because it could be. And it would be really important for you to maybe Google the symptoms of menopause and postmenopause, so that you don't feel like you're wackadoo. Like for me, I went through a period of intense rage. I was so angry, I wanted to slug everybody, like family members, people in the store. I just get this random sudden need to want to slug somebody. I never did, but I thought about it. It's like, man, I could really hit somebody right now. And my gynecologist absolutely confirmed that that was just what he called the rageous estrogen swings. So I would want to know, is there a chance that this is an estrogen swing? But the second thing, though, is that you don't have to do this alone. If you're feeling alone and like there's nobody else to help you, the great news is that you can work with a psychologist or a pain specialist or a psychiatrist, and you can work with them over online. They're not doing in-person meetings right now as much. They're doing virtual meetings. You can have a meeting just like this and tell them what you're struggling with, and they will have tools and tips that you can use. It's also about working to manage anxiety, because if you're spinning in a circle, like anxious, you can't do anything because you're just spinning in worry. It's like, oh my god, oh my god, oh my god, oh my god. It's like, whoa, stop the presses. Just grab onto something, stop for a moment. Whoa. We got to break the anxiety cycle, because that's driving a lot of the depression. And that's when skill building is really important, because God didn't give you the skills to deal with this when you were a kid or when you were born. We got to learn them. And right now, honestly, especially, our depression and our anxiety management and our stress management is being tested royally. I'm going to give you mine. This is what I learned in my phobies class that I took. Every time you have a negative thought, fill your brain up, just visualize a red stop sign, just like, okay, so here's my negative thought. Oh my God, it's fire season, starting again. Okay, stop sign. Slow, deep breath. In for 3. Out for 3. So that oxygen from that deep breath just turned off the adrenaline from the anxious thought. So stop sign, deep breath. And then the third thing is, you got to minimize the thought. You got to have something that you can say to yourself to remind you it's a freaking thought. It's not real. So what I say to myself is, oh my God, Jill, you're not God. You can't predict the future. arrogant can you possibly be to think that you know what's going to happen tomorrow? You don't. It's a thought. It has no power. Let it go, right? Stop sign, deep breath, minimize the thought. And that system completely changed my life. I have not had a panic attack since I took that class. And they sent us out when they gave us that, we're just like going, really, come on. And they said, no, 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 no. This is just about reducing the adrenaline in your bloodstream. We're just trying to calm things down, right? And so, they sent us off and they said, now listen, you're going to do this hundreds of times. You're going to be stunned. You have no clue that literally every thought going through your brain right now is an anxious thought. And they were right. I went home. I probably did it 100, 200 times. Easy. I was stunned when I actually paid attention to it. Damn, every thought was a bad thought. The next day, I did it half as much, maybe 50 times. The day after that, 25 times. The day after that, 12 times. The day after that, 6 times. By a week later, I was doing it once a day. And you know what? I was calm. Like, holy hell, I was calm. I hadn't been calm in a decade or longer because I'd finally taken control of the adrenaline level. And so, Vicki, I want you to try that. I want you to try that. And of course, understand that there are people that can help you, whether it's taking a depression class or an anxiety management class or speaking to somebody. You don't have to do this alone. Denise says, who is Donna Townsend? Donna Townsend is one of my very, very good IC friends. Let me tell you, right there. She's been very helpful with IC Awareness Month the last couple of years. Carla says, music touches me like nothing else. It's pure emotion. Yeah, man, that's what I do. The other thing I do is I just, especially with fracturing my 2 front teeth, and you can't see it, but there's fractures of both teeth. It sucks. When I start feeling it, man, I just turn on the music really loud and I just go for it. JP says, any medication out there that you can take besides Elmeron? Yes, JP, as a matter of fact, there is. So Elmeron so remember, Elmeron was approved in 1996 by the FDA as a therapy for IC. The theory back then in 1996 is that IC was a bladder disease. And so, and that up to that point, the only therapies they had involved catheters. And Dr. Parsons, the gentleman who invented it, said, we wanted to create an option for somebody who could not tolerate a catheter. So they created an oral medication that was basically created kind of a chemical Band-Aid for the bladder wall. And this would apply to IC subtype 2 bladder wall driven, especially for estrogen atrophy. And so Elmeron is a protective coating. Let's see. Where is my... There we go. And so this is an Elmeron postcard from, I don't know how long ago, man, 2005, baby. And so you can see that this is what Elmeron does. So this is the protective mucosal barrier in the bladder. Your bladder has 3 layers on the outside. There's a nice thick coating of mucus. Then we've got urothelial cells, largest cells in the human body. And underneath that, we've got blood vessels and nerves and mast cells, right? So if the urothelium, if the mucosal barrier, also known as the glycosaminoglycan layer, is damaged, whatever's in your urine can get down to these more fragile cells. And so this is where if acid gets in here, it's going to damage these cells, or bacteria gets in here, it's going to damage these cells. So Elmeron provides a protective coating. Unfortunately, Elmeron also has now been linked to retinal disease. That apparently, and this is something I didn't know, is that the retina has a kind of gag layer structures too, glycosaminoglycan structures too. And so what's happening is that the Elmeron is also now attaching to the retina, and it's not good. So Elmeron's off the table now for the vast majority of patients. So what can you do instead? Well, you can go back to direct bladder therapies like a rescue installation. You can do a heparin lidocaine installation, or you can do an Elmeron lidocaine installation. When you put a medication topically, you're delivering 100% of the medication directly to the area that needs it. One of the reasons why I didn't take Elmeron was that the bioavailability was so poor. I mean, listen, if you swallowed a Band-Aid, would you expect it to come out the other end of Band-Aid? And the answer is no, we have digestion. More than 93% of Elmeron is destroyed by digestion and never makes it to the bladder. And a couple of doctors have now said in some of the classes that I've said that it's actually more than that, like 95% of Elmeron is actually destroyed by digestion. As a consequence of that, you have to take a lot of it over a long period of time for it to be helpful. But if you put it directly in the bladder, 100% of the medication arrives in the bladder. So the best way to do a bladder coating is in the form of a bladder installation. But of course, the challenge there is you have to pee it out. You are going to pee it out within a couple of hours, and we don't want you to hold it. You should never. They call it dwell time. For the dwell time for most medications is 20 minutes. You don't want to try to hold it in pain for hours. That would be ridiculous. It would be counterproductive. So what most patients have been doing now for years now is transitioning over to a chondroitin-based supplement, So hold on a sec. I just got a delivery. I have a whole bunch of goodies here, which are going to be part of my gift baskets to some of you guys. So what are our chondroitin-based supplements? Well, hold on. Bladder Builder. So Bladder Builder is, in my opinion, the best supplement on the market today. And the reason why is because it has a lot of different things in it that have the potential of being helpful. So it's got chondroitin for the bladder wall. It's got quercetin as an antihistamine. It's got collagen for the bladder wall. It's got beneficial probiotics for the gut and the urinary biome. But most importantly, it has PEA, palmitoethanolamide, which has been proven in research to reduce pain in IC patients and or neuropathic pain. And so we just did our 1-year follow-up study with Bladder Builder, and 60% of the patients who take it or who've tried it are still taking it today. And in that group, over 20% are now completely symptom and pain-free, and the rest are doing pretty good. The people who stopped it because they either couldn't afford it. It's $46.99, or their doctor wanted them to do something else, or they had a side effect. And all of the supplements can cause a little bit of gut distress. You normally don't take them on an empty stomach. So there you go. Bladder Builder is one option. Hold on. If you are super sensitive and you flare when you do probiotics, then you don't want to do Bladder Builder because it's got probiotics in it. Some people flare with probiotics because you are remarkably sensitive to histamine, and some probiotics can trigger a very strong histamine response. So if you're somebody who's super sensitive like that, the next thing you can do would be Bladder Rest. And so Bladder Rest is a really simple formula of chondroitin, quercetin, vitamin D3, vitamin K2, L-arginine, and L-citrulline. And instead of being in an olive oil base, this is in an avocado oil base. Is it? I think it is. Okay, no, this one's in the avocado oil base. All right. Or you can do Cystoprotect. Cystoprotect's been out forever. 20 years. I did the product launch for Cystoprotect back when it first came out for Dr. Theorides. This was absolutely the top supplement on the market for years. Patients have been transitioning off of Elmeron for more than a decade because once it went off of patent, the company jacked up the prices in anticipation of a generic. And so the price of Elmeron skyrocketed and a ton of patients couldn't afford it. And because they couldn't afford it, they needed something different. And so Dr. Theoharides, a federally funded IC researcher, is a researcher who invented Cistro Protect 20 years ago. And it was absolutely the top supplement for 20 years. Until last year, when they had a debacle with the label and they added a cancer warning to it because of an ingredient called titanium dioxide, which is in a ton of stuff. It's a white food coloring. But anyway, Cistro Protect died overnight because they added a cancer warning to it and they didn't explain it. That has since been resolved. That ingredient is out. And if you're an older Cistro Protect user, the capsules are no longer brown, they're red to remove that ingredient. So Cistro Protect is viable, it's out, and it's available. Or you can do CystoMend. So CystoMend is almost identical to Cistro Protect with the addition of pumpkin seed extract for an antioxidant effect. We've got lots of research showing that pumpkin seed extract can be helpful, especially for men with prostate issues. And I don't remember the other study. I can tell you that I'm going to say like 10 years ago at AUA, the American Urology Association, there were pretty good research presented about pumpkin seed extract. All right, so this is viable. What else do we have? Peora is not a chondroitin-based supplement. It is just the pain-reducing palmitoethanolamide. And so people ask me what I'm taking, and this is what I take because my bladder wall's healthy. It's about calming my nerves down, and that's what this does. And the cool thing is it's the cheapest supplement of all. It's just $24, $24.99. For those of you who want a vitamin, you need a low acid vitamin because you're not eating well. Oh, my friends. Y'all got to check your B12 levels. You have to check your B12 levels. I'm going to go more into that later, but we now have 2 independent researchers who are continuing to confirm that B12 processing may be part of the issue for some of us. And so I know my B12 levels were rock bottom 10 years ago when they tested them. I had low B12 and low vitamin D. And if you're low on B12, you're going to have more neuropathic pain. You're going to have neuralgias. Your feet are going to hurt potentially, or your hands are going to hurt, or you're going to get pins and needles. Those are signs of B12. And so next time you go to the doctor, ask if they'll check your B12 levels. That'd be very, very interesting. We do have a low acid multivitamin called Bladder Smart. We did the first one, which was Multirite. That was actually my idea 10 years ago with Far Laboratories, but the pill was just too big. People couldn't swallow it, myself included. I had to cut it in half. I do not do well swallowing big pills like calcium pills. And so I asked Natural Approach Nutrition to make it smaller and smaller capsules, and that's what they did. These are in vegetable capsules. So 3 capsules of this equal 1 Multirite. I like that because you can titrate down because I don't believe in taking a lot of stuff anyway. And the rest are kind of gifty things. I want them to be a surprise. But I also, you guys, found in my warehouse, look what I found in my warehouse. Pre-leaf stir-ins. These are pre-leaf powders. And they got damaged in shipping. I have 5 of them. And I will give these away. I will either put them in gift baskets, or if anybody wants some pre-leaf stir-ins, if you email me icnetwork@mac.com, icnetwork@mac.com, I might be able to send you some stir-ins. I might take them out of the box. So if I take them out of the box, they're like this, and I'll just throw some in envelopes, right? So if anybody wants some pre-leaf stir-ins, email me icnetwork@mac. That's M as in Mary, A as in Apple, C as in Charlie, icnetwork@mac.com. And I'll throw a bunch in an envelope to you. And I'd be happy to send these to you, no charge, my friends. No charge, right? No, it's Christmas. All right. I also have, what are those? Heather's tummy fiber things. So I'm giving 2 gift baskets away every week through the holiday season to IC patients. I haven't sent my ones from last week yet because last week I was dealing with dental issues. But I'm going to pick 2 people this week too to get a free gift basket of stuff from the IC network. And so all you need to do is email me your mailing address, icnetwork@mac.com, and you may get a gift basket from us. Hello, Iris and Don. Nice to see you. So JP, I hope that helped with the supplements. There's no way to say which supplement will work best for you. The first thing you've got to do is look at your sensitivities. If you can't tolerate aloe, then you're not going to be able to do aloe. Oh, I didn't even mention Allopath. Aloe can be helpful for some patients too, because aloe has a calming and soothing effect. But the new Allopath is the aloe that we're selling now. We have discontinued the Desert Harvest aloe. We are only going to be selling this one. And the reason why is because it also has PEA in it for pain relief. So I'm really excited about this one. All right. Gina said, had a few installations over the past 2 months, haven't had any IC symptoms. Yeah, baby. We're going to celebrate every success story. Fingers crossed, installation really help, and I'm able to do myself when I get symptoms. Awesome. Amanda says, my urogynecologist told me if I don't take Elmeron, there's nothing else she can do for me. I am also in physical therapy, but your muscles are not tight. You're not food sensitive. You're just very, very bad urgency. All right. Okay. So Amanda, so number one, if you're not food sensitive, now, we got to be real here. We got to be totally real here. If you've got frequency or urgency, that urgency is coming from a specific nerve group called the alpha afferent nerves. And generally, we're going to see that with some sort of daily irritation to the bladder. And so we got to rule it out. If you've got urgency, you're having issues. You're in a flare. But you say you're not food sensitive, you're just drink sensitive. Okay. So it's really, really important that we finesse that diet just to make sure that there's not something in your daily life that is provoking your bladder, like a multivitamin. Do you take a vitamin every day? Do you drink water out of a Brita water filter? Or is there another supplement that you're taking that might be irritating your bladder? Okay. Are you drinking green tea? Are you drinking black tea? Are you drinking soda? Are you drinking coffee, even decaf? Okay, those are all things that we would associate with really intense urgency at night. The fact that she's telling you that if you won't take Elmeron, there's nothing else she can do is disgraceful. Because the American Urology Association has a 6-point treatment plan, a 6-step treatment plan for patients with bladder issues. And let me get that, and let's just go through that real quickly. Hold on. So the American Urology Association created an IC treatment plan. They created it back in 2011. And the reason why they did that is because there were so many doctors treating IC so inconsistently and differently that they wanted to have a standardized protocol. Now, this is before subtyping, because we only started subtyping, like in the last 5 years. And so I'm going to say that the American Urology Association IC plan is really the best for IC subtype 2 or subtype 5 central sensitization. But let's just take a look at this protocol real quick, okay? And then, Gina, you can find the link for this over on our website in our treatment area, or I will post it here. But let's go through this. So first of all, understand that this is the American, oh, darn it, I just clicked on something. You guys, if you're in Europe, I'm not going to be able to send you supplements. The European Union refuses them. Okay, here we go. American Urology Association, largest urology association in the world. It is the preeminent urology association. At their conferences, we'll have 25,000 urologists come to learn about the latest in urology, as well as research studies. You can Go get the guidelines yourself here, auanet.org. auanet.org. In the upper right-hand corner is a link that says guidelines. Click on that link. When you get to the guideline page, type in interstitial cystitis or bladder pain. You'll have the guidelines. It's about 60 pages. Print 3 copies of them. You need a copy for you. You need to give a copy to your urogynecologist who apparently has never read the guidelines. And number 3, you always carry an extra set of guidelines in your car for any other doctor appointment or an emergency room. All right. So in the AUA guidelines, it's arranged in 6 steps, and it's about putting your safety first. So they want you to do the easy stuff before you do the hard stuff. So in step 1, we want to make sure your water intake's good. We want to do diet because, hello, man, I was working with a lady who literally didn't drink, only drank diet soda for like 25 years. The damage that did to her bladder is undeniable, So it's about getting your water intake up. It's about changing your diet. AUA wants you to do muscle relaxation. We want to do acupuncture because that can potentially calm nerves, but also they want you to try the supplements. Why? Because the supplements have fewer side effects than Elmeron. They want you to do the easy stuff before you do the hard stuff. Now, they don't mention brand names, although the one thing that they do mention very, very clearly is, again, Preleaf, calcium glycerophosphate. Preleaf reduces the acid in foods that you're eating so that it won't be as irritating. And so the one supplement that has been out for 30 years and counting is Preleaf, and it's generally very well tolerated unless you have kidney stones. If you're prone to pushing kidney stones, you cannot do Preleaf. It's a calcium product, calcium glycerophosphate. And you don't eat it like candy. It's not a treatment. It's not going to do anything for your bladder. So don't keep eating it like lifesavers. It doesn't work that way. And all that calcium has to go somewhere. And it could go to kidney stones or end up in your bloodstream. So you only do this when you're going to eat a risky food. Okay. Let me drink some water here. In for 3, out for 4. All right, step 2. The step 2 interventions from the American Urology Association are going to be physical therapy if you have tight muscles, oral medications. That's where they put Elmeron. Of course, Elmeron's qualified now, and I think they might even be taking it off completely. Elavil to calm nerves down, hydroxyzine, visceral atarax as an antihistamine. Those are going to be the classic oral medications used. They might suggest that you do bladder installations like a rescue installation, heparin and lidocaine, and of course, pain care. Now listen, the American Urology Association supports the use of opiate medication. They want pain assessed at every single appointment. Every time you go to your urologist, they should be asking you about pain levels. Why? Because we know that pain left uncontrolled can wind up your nervous system, and that's what we want to avoid. And so we want to do multimodal stuff, right? It's not just going to be pain medicine. It's going to be trying to figure out what the hell's triggering the pain. Now, I worked with one lady. Now y'all know that I've been doing this for 27 years. I'm the longest serving IC support group leader. We've worked with millions of patients through the IC network, 200,000 a month for many, many, many years. And I get to see and talk with a lot of different people. There is one case, though, that I thought was really, really tragic. And it was a husband who called on behalf of his wife who was in severe, severe pain. And he did not know what to do for her, that she was literally in her bedroom, in bed, taking very, very strong pain medications. And she would not do anything else. She simply refused to do anything. She wouldn't change her diet. She wouldn't go to the doctor. She wouldn't do anything. So I go over the basics with him, right? Including diet, right? And he goes, well, man, all she does is she drinks Diet Coke all day. That's all she does. She drinks Diet Coke and she takes her pain meds and she lays in bed. And I gave him the diet, gave him the information, sent it back, said, do your best, do your best. Well, he called me like 3 months later and he was just beyond despondent. It's like, she won't do anything. She will not do anything. She won't even call the doctor. She will do nothing. So it's like, all right, put me on the phone with her. Let me talk to her. She won't talk to you. She won't talk to anybody. She barely talks to me. It's like, put her on the phone. Let me have the phone. Let me get her on the phone with me. And so I finally get to talk to her. And again, this is before subtyping, before we knew anything. It's like, all right, honey, tell me what's going on. And she's just like, I don't care anymore. Just give me my pain meds and my Diet Coke. I went, wait a second. You're drinking Diet Coke? She goes, yeah, that's all I drink. I've drunk it for years. It's like, wait a second. Do you know that how damaging that is? That the bladder was not designed for that level of acid every day, all day, that the diet soda is literally chemically injuring your bladder. And that's probably why you're in pain. And she started screaming at me. She said, I don't fucking care. No, she was yelling. I mean, guys, that's what she said. I want my Coke and I want my Vicodin. Shut up. And she hung up the phone on me. Of course, her husband called me back and said, what do I do? And I said, hun, she is addicted. She's addicted to two things. She's addicted to Diet Coke and she's addicted to pain meds. So understand that the American Urology Association absolutely wants, they want your pain controlled because they know the longer you're in pain, the more your system gets wound up. But it's not just about taking the pain meds. It's about figuring out what the hell is the problem in the first place. What is the fundamental underlying problem? And yes, some people have addiction issues, especially related to Coke, not understanding the damage. It is what it is. I've told the story of a lady in New York that I worked with who she called, spent at least an hour with her on the phone, went through everything with her. I'll always remember her voice because she had a very shrill voice anyway. She calls me 5 years later. She's sobbing in pain. She says, nothing worked. I've seen everybody. I've seen the best doctors in the world. Nothing works for me. It's like, okay, what are your symptoms? Let's go over it again. So she was having pain as her bladder filled with urine that was relieved by urination, which is bladder wall pain. I go, okay, so you're having bladder wall pain. Are you following the diet? And she goes, yes. She's very belligerent. And her husband's on the phone. He goes, are you kidding? She's never followed the diet. She drinks a pot of coffee followed by a 6-pack of soda every single day. At which point in time, she loses it on the phone. She's wailing. That's right. Take away everything I love. I have no reason to live if I cannot have my coffee and my soda. Right? I mean, she's just wailing out of control. And I went and said to her, I said, now, wait a second. Now, I told you about the diet 5 years ago. Didn't you believe me? And she goes, no. Well, okay, I sent you to Rob Moldwin, 20 minutes away from your house, one of the top doctors in the world, the author of the IC Survival Guide. Didn't he tell you about the diet? She goes, yeah. Did you believe him? No. Nope. I said, okay, then you went to this doctor and then this doctor. They all talked about diet, right? She goes, yeah. And I said, you didn't believe him? She goes, no, it never applied to me. And what I said to her, I said, okay, how much money have you put into IC therapies? Ballpark figure. Tell me how much money you've spent in the last 5 years. She goes, $50,000. She was doing Elmeron, which is very expensive. She did InterStim. She did all sorts of stuff. And what I said to her that finally penetrated her brain was, do you realize that you have sabotaged every single therapy you've ever tried, that none of them had a chance to help you? You have thrown away $50,000. She goes, what? What? And I went, listen, there's no treatment that can counteract the damage that's being done to your bladder for you drinking a pot of coffee a day with a diet soda. There's no way. None of those treatments ever had a chance. You flush those treatments down the toilet. And then I explained the bladder healing. How the bladder is the slowest healing organ in the body. It takes 2 weeks for one cell to be replaced. While that cell is growing, one soda will kill it. So every time you have a soda, you completely interfere with the healing process. Every time you have a soda or you drink a cup of coffee and you got a bladder injury, you set yourself back 2 weeks worth of healing. That was from a lecture by Dr. Anthony Schaefer I taught at the AUA years ago. So I said to her, I said, now listen, your bladder has never had a chance to heal, period. You poured acid on it every day. What's going to happen to that wound? It's bigger. That's why you're hurting. And she's at this point in time softly sobbing. And her husband's going, I told you so. I told you so. I told you. And I'm like, what do you have to lose? Give it a shot. Give it a shot. She called me back 3 months later. She goes, oh my God. I was like, what? She goes, you're not going to believe it. I'm like, okay, what? She goes, I'm off the coffee and the soda and I'm better. She said, I'm better. For the first time, I'm better. And I went, congratulations, hon. That's awesome. But sometimes you got to confront bad habits. And that coffee habit and that soda habit is devastating. Diet soda, artificial sugar can be devastating. All right. Pain management. Pain management is important. But y'all, we also got to be real. And sometimes we can be reinforcing our pain through, just because the lack of knowledge. Like I did, drinking a quart of cranberry juice a day for a year, not having a clue that was the equivalent to drinking coffee. We all did it. IC subtype 3. Not subtype 3. Step 3 treatments. That's when we're going to do a cystoscopy to look for Hunner's lesions. And generally, we don't normally do a hydrodistension now as a diagnostic method unless your diagnosis is in doubt. So if you got something weird happening and they don't understand why you're having this symptom, or if you're bleeding and they want to look at your bladder to figure out why you're bleeding, that's when we do a hydrodistension. It should be a low pressure, short duration therapy. We no longer do high pressure, long durations. Back in the old days, they used to really stretch the bladder with water and leave it in there for a long period of time. And the theory was if you stretch the bladder out, you would improve bladder capacity. But the problem with doing that is you can rupture the bladder. And so we no longer do that. Hydrodistensions are meant to be brief and non-traumatic. So they are done low pressure, short duration. If you have Hunner's lesions, they're going to be doing at that time, anytime you have a hydrodistension, you're always going to ask, what are you going to do if you find Hunner's lesions? And if they say nothing, you're going to say, why not? And they're going to say, well, because we don't have the equipment to do it. And then you're going to say, okay, tell me a doctor who does have the equipment because I don't want to have this procedure twice. So if you got Hunner's lesions, they're going to fulgurate them or treat them with heat, or they're going to inject it with a steroid. This is no longer available, Lyris, which is too bad because this is the first treatment that actually healed Hunner's lesions, or hyperbaric oxygen therapy or antiviral therapy if you do a next-gen test and they find an active virus. Viruses are sometimes the cause of Hunner's lesions, so they might do antiviral. Step 4 of treatments is going to be neuromodulation to calm nerves down. So the ankle PC the ankle post-tibial nerve stimulation is called urgent PC, or they might do interstim at the on the sacral nerve or the pudendal nerve, or they might do Botox to calm a nerve down. Step 5 is kind of the miracle treatment for many, many patients. It's cyclosporin. Cyclosporin is a strong anti-inflammatory. And there's more to it, and I don't remember what it is off the top of my head. The challenge with cyclosporin is it has a lot of potential dangerous side effects. That's why it's step 5, including high blood pressure. So if you're doing cyclosporin, they do very, very small doses, and normally the urologist does not do it. Normally you're sent to another doctor to have that done. Step 6 is, in fact, going to be surgery. It's rarely done. We rarely do surgery unless the bladder is severely compromised or damaged or shrunken. And the treatments we no longer do are long-term antibiotics, Bacillus calmette-guerin, racinoferritoxin, silver nitrate, chlorpactin, high pressure hydrodistension, and long-term steroids. So as you can see, there are a lot of therapies, not including the supplements. And generally, you would do the supplements first. That's what the AUA says, before you dive into something that can be more aggressive. So for anybody who says Elmeron's not the only therapy, they're crazy. Brenna says, thank you, Laquette. Laquette sent us 50 stars. If you like these meetings, one of the ways that you can support us is if you're on Facebook, you can gift us stars. Or you can come on over to our website, icnetwork.org. icnetwork.org. And you can make a donation or become a member and get our magazine. Your choice. So Brenna says, you went to your doctor and discussed estrogen atrophy. The doctor gave you Premarin, and I've kept my urethra covered in it for 3 days, as well as put it in my vagina. So far, no relief, and the pain is so bad. I'm starting to lose bladder control, frequency, urgency. The pain is horrific. So Premarin, unfortunately, is the one estrogen product we would not suggest to you, Brenda, because it's known for causing a lot of extra burning. Because it's got a lot of extra preservatives in it. So has the pain gotten worse as you've started the Premarin? If it has, then this is very, very common. Normally, you would ask your urologist or your gynecologist for a compounded preservative-free estrogen cream instead. Wendy, I see these things are back again. Sister Protect. Yeah, so we've had Sister Protect almost a year now. It came back last January. Robin says, I took Elmeron orally, but thank God I couldn't tolerate it. I also tried bladder and stills. No help. I have Sjogren's now, worse than back then. Could that be linked to Elmeron? I don't, at this point in time, I just don't know. I mean, we're learning a lot about Elmeron we didn't know. Sue says, can anybody help with ulcers? So ulcers are done in 3 ways. So we're going to cauterize them. We're going to inject a steroid in them, hyperbaric oxygen therapy, or an antiviral, because Sue, we have now found viral infections in many patients with Hunter's ulcers. So specifically, it's a polyoma BK virus. B as in boy, K as in Kelly, or the polyoma JC virus, J as in Jill, C as in Charlie. These are viruses we all have. They're part of the biome. They just get turned on in some patients and have been well known to cause hemorrhagic cystitis. So, Sue, it'd be very important for you to have a next generation urine test by maybe a periomics that will test to see if you have an active viral infection in your bladder. And if you do, what they then may suggest is that you do an antiviral medication and or at least lysine. Brittany says, do I have any knowledge of Axonics? Isn't that a neuromodulation device? Pamela says she can't find a doctor for pelvic pain. Pamela, go to pelvicpain.org, the International Pelvic Pain Society. They have a Find a Doctor database right on their website, or you can go to our website. Our list has not been updated well. It's just, it's really low on my totem pole right now. But if you can go to pelvicpain.org, you will see a current list of doctors treating pelvic pain, and you can search it by zip code. Jennifer is taking Myrbetrix and it's working. That's great. The nice thing about Myrbetrix as a medication is that it can help reduce anxiety. I mean, I'm sorry, not anxiety, frequency, urgency, but it is not an anticholinergic medication. And so it doesn't come with the side effects. With the cognitive side effects. Anticholinergic medications have been linked to cognitive decline and dementia. So we don't want to be doing a lot of anticholinergics every day. If you do it every day for 3 years, I think it's 3 years, it increases your risk of having cognitive issues. So Miratrick is a way to get around that because it's not an anticholinergic. Hello, Jamie. Jamie, girl, how nice to see you. It's been ages. Melanie says, getting the acidity down in the body is key. I take drops to reverse the body to alkaline. I've been a year now with almost zero pain with IC. I still have frequency, but that's my fault. It's a coffee. So Melanie, here's the thing, is when you're doing your alkaline drops, the only thing that you're alkalinizing is your urine. You're not alkalinizing your body. The pH in our bloodstream is controlled minutely by various biological processes. And there's no supplement that is going to change the pH of your body. But what it is doing, it is changing the pH of your urine to make your urine less acidic, which is important since you're drinking coffee. Melanie says, has anybody tried marshmallow root? Yeah, you can get marshmallow root on our website. Marshmallow root is kind of a mucosal product. And it can be helpful. Here, hold on a sec. About half of the people who do marshmallow root react to it, and the other half do really well with it. It's certainly worth a shot. I don't see why you wouldn't want. I mean, I think at this point in time, remembering that we're all different. What works for one person might not work for you, and vice versa. And so, is it worth trying? Sure, I think it's worth trying. All right. It is time to start our Zoom meeting. All right. So the way you guys do this is we usually do this hour and a half or so live on Facebook and YouTube. And then we switch over to Zoom, but the Facebook and the YouTube are still open, but we'll be over on Zoom for however long we need to be. And this is where you get to ask me questions and tell your story. And so this is basically online coaching, for lack of a better term. And so let me just start that. The meeting is now up. So we will be in Zoom. You all are still going to hear me. You're going to hear the patients. You won't be able to see them. And if nobody wants to do it, that's fine. We'll just come back here. I got no issue doing it or not doing it. I think it's kind of cool. All right, Facebook, there's your Zoom invite. YouTube, my friends, where are my friends on YouTube? There you are. Shelly says, how about Saga Pro? I don't know anything about Saga Pro. I don't know what that is. Hello, Bola. Nice to see you. Hello. Nancy says, what's wrong with the Brita water filter? It's too good. It takes out so many minerals that it actually, it takes out the pH balancing minerals that control acid level. And so when you use a Brita water filter, you're drinking acid water. And it sucks. All right, let's do it again. In for 3. Out for 5. Let's do it again. In for 3. Out for 5. Carla says, I used to have a feeling back before my hysterectomy and diagnosis of a tampon not being in place. Now I still have that once in a while, and I'm realizing it's actually a sign of an IC flare-up. You know, Carla, feeling like there's a foreign object stuck in your vagina or rectum is absolutely a symptom of pelvic floor. Hello, Sarah. Sarah's coming into the Zoom meeting. So, Sarah, I'm not going to turn you on right away. Let's just give it a couple more minutes. Hello, my friend David. It's nice to see you. Hello, Annie. It's nice to see you too. Melanie says it was alkaline drops with a probiotic and prebiotic. Awesome. Power to you, girl. If it's working for you, it's working for you. I am in no place to judge that. I just try to balance. My goal here is to just give you as many options as possible and to try to explain the science a little bit more. Believe in science. Becky says, what do you recommend instead of Brita? Spring water, bottled spring water. Reverse osmosis water, maybe. You don't want to do distilled water. Hello, Keith. I'm letting Keith in. You don't want to do distilled water because distilled water has no minerals in it at all, and you need your potassium and your calcium. You need those minerals. Irene says, can you tell me about Cystomen? So Cystomen is the equivalent of Cystoprotec. So it's got, here, hold on, I gotta let Sarah in here. So it's got chondroitin for the bladder wall. It's got hyaluronate for the bladder wall. It's got quercetin as the antihistaminic effect. It's in an olive oil base. But what they added to it was pumpkin seed extract for the extra anti-inflammatory, antioxidant effect. And it is in the olive oil base for people who like the olive oil base rather than the avocado oil base. Melanie says she wants to try bladder rest. Very interested in that. Going to do some research on all of them. I have a supplement guide in our store right on the front page. I also have an Elmeron transition guide in our store. Sue says, they ruptured my bladder during a hydrodistension. Then they did nothing for numerous Hunter's ulcers, recommended bladder removal instead. Girl, holy hell. I'm so sorry. I am so sorry. So the question is that if you had a lot of Hunter's ulcers, your bladder may have just been much more thin and vulnerable, and that might have been why your bladder ruptured. But they should have done something for your Hunter's ulcers. I don't understand why they wouldn't have done that. How long ago was that, Sue? You should come into the Zoom meeting. I'd love to hear more about that. Laura says she needs to learn more about the diet. Come on over to our website, icnetwork.org. Patty says, when I got diagnosed, gave up my Mountain Dew cold turkey. I love that stuff, but I only drink one bottle a day, although I didn't drink near enough water. Last time I took a sip of Mountain Dew, it thought man, you want to talk less about the worst soda out there? Yeah, Mountain Dew. Jennifer says, I take vitamin C to help my iron pills absorb. I'm anemic. Is this hurting my bladder? Yes, it is probably hurting your bladder. Ascorbic acid is going to be one of the more irritating things. Patty says, how does IC relate to a urocele and a rectocele and a rectal prolapse? It's all about your pelvic floor muscles, hon. You got very weak pelvic floor muscles. Lori says, does this help major panic attacks? I don't know. I mean, we talked about panic earlier. Panic is all about reducing adrenaline, hon. That's the stop sign, deep breath, minimize the thought. And maybe if you're having anxiety because of estrogen atrophy, menopause, the estrogen might help. And of course, there are other reasons why people might have an anxiety disorder that you might need to work with a psychologist with. Jennifer goes, crap, girl. Absolutely. All right, listen, before we start the Zoom meeting, I'm just going to go take a quick bio break. So everybody, it is time to go to the bathroom. I'll meet you back here in a minute. Oh, I just jammed my thing. Okay, hold on. All righty. All righty, my friends. All right. So let me post the Zoom link one more time. And so Facebook, YouTube, y'all are going to hear this. I will come back and take your questions after the Zoom meeting, but it would be awesome if you all want to come on in, feel free. You will then be able to ask your own questions and tell your story. And it's very important that we share our stories, son. It's very important. Y'all need to understand the diversity in this patient population. All right. Hello, Sarah. How are you doing today? How is life?
Well, life is, very different, as you are probably experiencing some of the same things. So I'm home, pretty much hunkered down with the whole COVID thing.
Yeah.
I have, multiple conditions. I call myself a walking itis. So I was diagnosed with IC in 2009.
Okay.
At that time, I kind of knew exactly what I was in for, because I have an older sister who also has IC, and she had suffered with it for probably 10 years plus before I was diagnosed.
Okay.
So, that was years ago. And at that time, I went on Elmeron immediately.
Okay.
And it did help me for many, many years until, the findings with the whole visual problems. And I am one of those patients that's losing my vision.
Damn it.
And so I know it's just like, oh my gosh, but I have so many sideline conditions. I have colitis, which is in remission, but I take infusions. So I have a weakened autoimmune just because of I'm on auto, immune suppressants.
Okay.
And it's working for one thing, but it's probably, maybe not so great for others. But at this point in my life, things are going pretty well up until maybe the last couple of months here. I have had reoccurring eyes, and every few years I get these, and I have them back to back. Probably about 3 years ago, I had probably 4 or 5 rounds of antibiotic, and the only thing that turned it around at that point was going in for installations, and that was before I went off Elmeron. So they used the heparin, Elmeron, whatever the different. But I don't remember the exact cocktail at that time.
Okay.
But that worked. And then I was very careful for a while again until things came back around. I, have experienced over the years what I can eat and what I can't eat, and when I can maybe kind of cheat a little, and all those kinds of things.
Sure.
So anyway, we can't get to the bottom of why either I don't recover and the bacteria is not totally killed, and then within going off of the antibiotic within like 10 days, 2 weeks, I'm back on. Although I am married and I am intimate with my husband, and so there have been times when I have been on a antibiotic preventative. So every time we're intimate, then I take an antibiotic that night just to, kind of, or that day, whatever. And then my urologist has suggested that I go on a routine of using D-mannose, which I've not really found a lot of relief with. I'm doing all the talking, but where, any suggestions at this point?
Well, okay. So first of all, I'm going to blow your mind. I'm going. I'm be prepared to have your mind totally blown. But The first thing I want to ask you is, do you have super sensitive skin?
I have super sensitive everything. Yes.
And does your sister have super sensitive skin?
Our whole family does.
Okay, so
Yes.
so genetics are at play here. So understand that some of us, not everybody's born to be a trial attorney. Okay, some people are born to be writers and poets, right? I mean, our genetic background matters. So I am Norwegian, and not just Norwegian. I mean, we're talking far, far, far north, Arctic Circle, Norway. So go back 5,000 years ago. 5,000 years ago, what were my ancestors eating? World's blandest diet. They were eating fish, they were eating whale, they were eating seal, they were eating berries maybe once a year. There was no coffee, there was no citrus, there was no spices, there was no pepper. I mean, they had a little bit of salt from the ocean, I'm sure, but that's it. And so from an evolutionary standpoint, I come from one of the most limited diets out there. That's what my body learned. And so kind of concept number one is central sensitization, that some of us are literally born with more sensitive nerves through heredity. This completely explains why I can't drink coffee. If I drink regular coffee, I shake like a leaf and my heart races for 36 hours. Okay, why?
I'm the same way.
Right, why? Because our ancestors didn't have caffeine. We've only been exposed to caffeine maybe the last 800 years, if you were wealthy. And if you weren't wealthy, maybe, because their coffee was ground up acorns. There's no caffeine in ground up acorns. So our body doesn't know how to process caffeine. It hits us like a sledgehammer. And the same thing is true with chocolate. Chocolate destroys me. That makes sense. Chocolate comes from Africa. So it makes total sense. I can't eat chocolate. I have bowel spasms for days with chocolate. And the odds are, as you were growing up, because you were so sensitive, they probably didn't let you do bubble bath or stuff like that because
no.
Right.
Well, that'd be awful.
Exactly. So we are sisters in sensitivity here, and you've already adapted your life for that. Okay, you probably don't have scented candles. You don't use chemicals in your home. You take the lowest possible dose of medications because you can't take higher doses, right? So we are the product of our ancestry. Okay, but I want you to get your B12 levels checked. So here's the thing. I did an article on our website several years ago featuring a lady named Barbara Flanagan. Barbara Flanagan was the founder of the very first ICA, UC San Diego. A lot of people think that today's ICA was the first ICA, Interstitial Cystitis Association, but they weren't. The original IC Association started in California, and they were very science-oriented. And they early on started focusing on B12 processing, that a group of patients were not
Thank you.
were not processing B12 correctly. And the science behind it is, where is it? So she was working with the National Institutes of Health, and they had major researchers that were focusing on that, and they got shut down through politics. The politics of IC would not let them go there. Okay, so anyway, so Barbara Flanagan for the last 30 years has been saying it's an autoimmune destruction of the hepatic vitamin B12 transport protein transcobalamin. Okay, so I didn't really, now listen, I'm a pharmacologist, right? My training's in pharmacology. This is so over my head. I can barely process it myself. There's another person who has been in the past a somewhat controversial figure. Her name is Ruth Kriz, Kriz. And Ruth Kriz has been around almost as long as I have been, maybe a little bit less. And she was focusing on infection. Why are, because she was partnered with Dr. Paul Fugazzotto, who believed that some IC patients had a chronic fastidious infection. And that was her thing, was that she was really working on the infection angle. And because most IC researchers didn't believe it, it wasn't something that I really spent a lot of time with. But she's brilliant. She's brilliant because about 15 years ago, she started asking, why are some patients more vulnerable to infection? And what do you think she found? A mutation in B12 processing.
Oh.
She's actually found now 10 different mutations. She has a group of 150 patients. And and she is focusing also on B12 and also on vitamin D. And we're going to be working with her in depth in the next year. I'm going to be doing an article with her in our current magazine on vitamin D as well. So the irony here is, again, when we're talking about genetics here, could we have inherited a B12 defect?
Oh, that's interesting, because I have a daughter that has also now been diagnosed with IC.
Okay, and so get all of your B12 levels checked.
She's like 24, 25 years old.
Yeah, but you were saying
it just breaks my heart.
Okay, but here, you can't. I don't want you to carry any guilt or any shame or blame because you have a daughter who has this.
I don't.
Because your mother had it.
But I feel, that I think my mother had it. I think my grandmother had it.
Right.
My mother always used to say that she had a very sensitive bladder, that her urethra was too short.
Yeah.
And that she got, was so sensitive to every little thing. And and she claims, her mother was the same way.
Right.
Well, they didn't live in this chemical world that we do.
But they
had issues.
Okay, but they may have inherited a B12 processing defect, which creates an environment that allows infections to flourish, specifically biofilm infections. And so more on that to come. The science is very, very complex. Ruth right now is working on a huge medical care provider training. She's about 60% done with that. As soon as she's got that, we will get out. Shelley here says, I have very low B12 and D. I'm part Norwegian. Right. And again, so that may be the genetic connection. The genetic connection may be this DNA defect that she's finding. 100% of her patients in this group have it. Every single one of them has it.
Where is she located?
She's in Texas now, but she's teaching now. She's not seeing patients. So,
okay.
But it's very, very exciting. I will have much more on that in the next couple of months. And again, it's helping us understand context. And then in the meantime, what you probably want to try. And so D-mannose, all that's going to do is attach to bacteria and help it flush out of your body. You really want a proanthocyanidin product. And so it's either going to be Allura or Peora. Oh, not this one. Hold on. Where is it? Prevent. Where is it? This one right here. Prevent.
PRVNT.
Right.
Is that something you take each day then?
Yeah.
UTI support. Okay.
Right. So it's either going to be.
I will investigate those.
Allura, which we don't have. Allura's about $125. This is only $65, and it's made by the same company that makes Bladder Builder on all those others. They were asked to make this by Dr. Ken Peters, the top IC researcher. He specifically asked them to create this product for women who get recurring infections. Okay.
Okay.
So,
excellent.
Yeah.
Okay. Two other questions.
Yes.
Vision related. So after I watched the Zoom meeting that you had with the group from Milwaukee.
Yes.
I did research in my area, different attorneys and so forth, and my husband comes from a legal family, and so he has connections so far. So anyway, we did go with the team from Milwaukee and Chicago.
Okay.
And so we have filed part of that suit.
Oh, you have.
Yes.
Awesome.
I have major damage in my left eye.
Okay.
And just, a few steps behind in my right.
Oh.
So I'm no longer driving other than very close to home in ideal weather conditions. If it's an overcast or if it's a cloudy day or if it's raining or if it's too sunny or if it, it's just
you should be
life-changing, so life-changing.
I hope you're angry.
I am so angry.
You need to be as pissed.
I told, I forget her name now, one of the attorneys, that, I'm not doing it for the money. I'm not doing, because, it's very emotional to go through this whole process.
Yes. Yeah.
And to know that they knew exactly what could happen to us, and yet money outweighed our health.
That's what it is. That's the concern. Is it is in their first research study they found eye damage.
When I was first diagnosed and sent on, I went to several different specialists. I went to the Cleveland Clinic ophthalmology group there. I went to the University of Michigan to the group there. I've been to my local, specialist and retinal specialist, and I was diagnosed with and I did have a severe vitamin A deficiency. Have you heard of any correlation between vitamin A and the Elmeron?
I haven't. No, I haven't. I really haven't.
Or even vitamin A and IC at all?
Well,
because I don't process my vitamin A properly either. I was on injections. I was taking mega doses orally. Nothing was working until all of a sudden something clicked, and then I went the opposite way, and I had toxicity where it was awful. I itched for a year.
Oh my God.
I itched so bad. It was torture.
So I mean, we could make a case for the fact that some people, their diet is remarkably limited because they have hunter's ulcers or something like that, and they just simply could not eat enough food, and they basically become malnourished.
I was that also because of my colitis situation.
Right.
So that was going to be my last question then, is the correlation between Elmeron and colitis.
Well, it's there. It's there.
There a little bit.
It's there. I mean, Elmeron is known for causing gut distress. There's no doubt about that. But you also have chronic overlapping pain conditions, including a sensitive bowel. And so I don't think you're going to be able to make that association.
That did not start though until
after. Oh,
I was
okay.
diagnosed with IC and went on the Elmeron and all that. I never had any issues with bowel issues.
Okay.
Until I was, my late 50s, whatever.
Okay. Hey, I'm gonna share my
screen. Anyway.
Okay, so hold on a sec. I'm gonna share my screen for a moment.
Yeah, I don't want to consume all your time.
No. It's okay. This is what I want you to look at. This is the first research study that has shown a treatment for a pentosan pigmentary maculopathy. It's called anti-VEGF therapy. I want you to write this down. V is in Victor. VEGF. Right. So a 59-year-old woman was referred for decreased visual acuity and bilateral macular edema. She'd been treated for IC with pentosan for 10 years. Multimodal imaging showed the characteristic eye damage associated with that. She was treated successfully with intravitreal injections of, there you go. B as in boy.
Yeah, I can't see any.
Yeah,
yeah, spell it to me.
Okay, B as in boy, E as in Eric, V as in Victor, A as in Apple, C as in Charlie, I as in Iceland, Z as in zebra, U, M as in Mary, A as in Apple, B as in boy.
Whoa.
Okay. So this is the first published case study that showed that Pitocin eye damage was reversed.
That's amazing.
Right. And so let me show you where I found this. So all you need to do is go to the National Library of Medicine, which is PubMed.P as in boy, P as in Paul, U, B as in boy, and then med.gov. PubMed.gov. This takes you to the National Library of Medicine, and just put in there Pitocin maculopathy and search for it. And what you want to do is you would just want to display it by most recent. You'll find it. You'll find it in there. Okay.
One other little tidbit, and it's just an ironic thing, is that I'm a trained optometric technician. So I've worked in a optometrist and ophthalmologist office my adult life.
Oh dear.
And, you know, I stopped working, I had my children, and then I actually started working with a dear friend who's an optometrist, and she has been my saving grace through this whole thing.
Oh, I'm so glad.
I love her to death, and she has just been my anchor.
I'm so glad.
Me just whenever I, you know, need any little thing, and she's kept me in the latest and the greatest prescription so that my vision, at least what I have, can be used to the best of my ability. And so I am hanging in there, having a huge support system, you know, a very loving, caring husband and children that are all very much involved. And
well, so the good news is you're taking action. You're not sitting at home crying your eyes out. You are, well, granted, we're all sitting at home, but you know what I mean. Contacted attorneys, you're working with those attorneys, you're working with several eye doctors. So you've got the whole foundation of success here. And now we've got our first treatment that has helped. And so let us trust in God that we've got other things that are happening right now. And in the meantime, I talked earlier about how important it is that we not live in anxiety. And that's going to be especially true for you because you're going to be under the stress of a lawsuit combined with, you know, the stress of wanting your eyes to get better. So, girl, lots of mind-body medicine at home, lots of deep breathing. Be kind to yourself. Be nice to yourself. You've done nothing wrong. Treat yourself. Reward yourself at every single doctor's appointment. And just know that you're my hero. You're my hero for standing up. You're my hero for asking for accountability and for helping others. And I really, truly hope that we get there.
I have been on your site from day one. Immediately when I was diagnosed, I came home. First thing I did was get on the internet, look up your site, learn everything that I possibly could to, you know, my own advocate or whatever, because you have to these days. You know, no doctor knows it all.
And it's a very dynamic environment right now, because what we're going to try to do with the data that I have with Chris now, what we're going to try to do is bring in a couple of the top IC researchers to see if we can verify this B12 processing disorder. And if that's it, we're going to know what to do. So lots of good things happening. Okay.
Yeah. So thank you so much for everything that you do for us.
You are very
I
welcome.
know that we're probably not appreciative enough, those of us that are sitting at home behind the scenes, but you're an amazing woman, and you have done great things for the community.
Thank you. Well, a lot of
Hang
people.
in there.
Well, yeah, I know. I'm looking at your two front teeth with envy because you have a beautiful smile.
Oh, well, you know what? That was another thing. I had jaw surgery, and then I had to go into, I was going to say dentures, but they're not dentures. Orthodontics for 2 years
Yeah.
as an adult woman.
Okay.
So
I
that was
hope in
bad
2
too.
weeks I have a smile as pretty as yours.
Aw.
All right.
All right. Take care.
Big
Thank you
hugs.
so much for your help.
Keep in touch. I want to hear
Oh,
how it
will
all
do.
goes.
Okay.
All
Bye.
right. And then we lost our second one, the second person that came in who left. It was a gentleman, Ken. Ken, if you're watching, please come back into the Zoom meeting. You are up next. We're going to go to iPhone. Whoever is on the iPhone, but you don't have your name. So iPhone,
Hi,
I see a face.
is it Sherry?
Yeah. Oh, hello, Sherry. How are you doing? Long
I'm
time
good,
no
good,
see.
Yeah, Sherry Handy Diggs. It should be there somewhere.
Sherry!
Came off.
Big hugs to you, Sherry. How are you
Thank you.
feeling today?
I'm feeling a lot better today. I'm having a good day,
Okay.
and so that's good. I just want you to know that I've been taking the other pain medication because they've taken me way down on the hydrocodone.
Yeah.
I'm on a lower dose,
Okay.
right? Because the state wants us off of it.
Right.
So they left me at 7.5 milligrams, 5 pills a day, because I even go round the clock at night with the pain.
Okay.
So, because my nurse practitioner was saying, well, are you taking it at night while you're sleeping? I said, well, yeah. She says, why are you taking it at night? I said, because I'm in pain. So she added the extra one on because I kept running out. But anyway, I'm also taking buprenorphine, which is a Belbuca brand name.
Okay.
And it's a sublingual.
Okay.
You put a pill under your tongue.
Okay.
So I'm taking a smaller dose of that, and they're going to probably raise that and continue lowering my hydrocodone.
Okay.
But
Okay.
right now, that works. Right now, the way it is, it's working.
Okay. And so just for the audience or for people who are listening, is your pain coming from your bladder, or is your pain coming from your pelvic floor, or from something else?
I think mostly from my pelvic floor.
Okay.
But I think I do have subtype 2 and 3.
Okay. And so what are you doing for your pelvic floor?
I think that's right. The what, bladder wall?
Yeah.
Ribbon,
Subtype 2 is bladder wall, subtype 3 is pelvic floor. So
yes.
So let's talk multimodal approach right now, because the pain medicine is helping with the symptom, but we want to fix the damn problem.
Yeah, but I've been in bed for a decade.
Oh, I know.
In bed.
Yeah, I know.
So
okay.
I'm very happy just to be able to get up.
What do you think is fundamentally pelvic floor driven?
Yeah, I do.
Okay.
And the reason why is because I have a rectocele and a cystocele.
Oh yeah, then it is pelvic floor driven.
And it's prolapse. And I guess I've had my bladder pinned up when I had my last baby. Well, I had a hysterectomy after she was born.
Okay.
And they pinned up my bladder. It may have fallen since then.
Okay.
That was back in the late 80s.
So how old were you when you were bedbound?
I suppose still am, but all the way from 50 in my early 50s.
Okay, and how old are you now?
Recently, 62.
Okay. So
I'll be 62 in February. I guess I'm not there yet.
Hey, man, cling to every day.
Yeah, I know.
Weird to be getting older. So I guess concept number one is that your pain was so intense that you absolutely could barely move.
Yeah.
And so there's no doubt that it's real. concept number two.
Right.
I'm just curious, when you go back to when you were 52 years old, what did they think was triggering it? Did the
I
doctors?
think that it was my pelvic, but they didn't even address it. You know, they didn't address that. We
Okay.
didn't know
And
until just recently.
okay. And what are they saying?
Listening to you.
Yeah, what are they saying now about your pelvis? Have they revealed anything? Have they discovered anything?
No, I need to see a gynecologist, another one, a urogynecologist. I've seen so many. But
Yeah.
I need to find one that actually wants to work with me.
Okay.
And yeah, and I need to. They did tell me to do physical therapy, and I do. After the pandemic's over, I do plan on going
Good.
to get the. This whole year has just been set aside, right?
Oh man, this whole year it's just the year that we're all gonna it's gonna be tattooed on our brains for infinity and beyond.
Yeah.
What we've gone through this
Right.
year.
But, yeah, I'm waiting to go to physical therapy, and I'm just following the diet as best I can.
Okay.
And
did you
just
have
getting
any
my
issues?
rest.
So before you were 52, before this all began, did it all?
Oh yeah, since I was in my 30s at least.
Okay.
Even when my son was born, he's 40. So when he was born, I knew I had something going on, but didn't know what it was at the time.
So yours
So-
literally could be a birth injury. All of your problems could have begun with a birth
Yeah,
injury.
I think that is what it's from.
Okay.
Exactly, Jill. I think it was pushing the babies out is what caused us.
Okay. Okay. So did you get the book, Breaking Through Chronic Pelvic Pain yet?
Yes, I did. You sent it to me.
Okay. And what?
I want it.
Okay. And so have you read it yet?
I've read parts of it. Yes.
Okay.
It's really, I tend to flip around. So
Okay. I know we all flip around, but you got to go back. So I want you to go back and read the first 3 chapters. And I want you to think about the birth and what the birth could have done to those muscles. Is your pain nerve pain, like electrical pain, sharp pain, buzzing pain?
No, it doesn't seem to be like that.
Okay.
It's more of a burning pain, just burns and aches.
And where?
Deep pain.
Deep pain.
In the middle of my bladder is where I would be thinking, and then like in between bowel movements.
Okay.
I get bloated, and because I have the prolapsing, I'm not going as often as I should.
Right.
TMI.
No, no. We'll talk about anything. It's not a problem.
So I have like a bulge down there where the feces will go into that little pocket, and then it won't come out.
You have to use your finger and push it against the perineum to get it to come out.
Yeah.
Oh, I do that. I have to do that too every now and then.
Yeah. So that is very painful because it makes you bloat all over and just hurt all over.
I have that. I don't have that. Well, okay. So the good news here is that you're on medication, which is helping you. You've got medication that is helping you function. And girl, you got to dive into this mind body medicine stuff too. We got to really work on the anxiety. Do you feel like you struggle with anxiety?
A little, but since I've been so much bedbound, homebound, I don't get out much. So I don't have a whole lot of different things going on, you know.
Okay.
It's been kind of calm and quiet. I even had a home health nurse for a while.
Okay.
Not a nurse, but an assistant.
Okay.
You know.
Okay.
I do think that there's a couple of things that it could play into it, and that is the endometriosis.
Yeah.
When I had my hysterectomy, they found endometriosis all over my bladder, on the outside, on the ureter, on the intestine, and I doubt if they cleaned it all out like they're supposed to. I mean, I know she said she worked on it for a long time and got most of it, but I'm wondering, could that go inside the bladder?
Maybe it can. No, it can. It can work into the bladder too. So
I'm wondering if it's embedded in me or something.
It could be. It could be. I mean, I think at a minimum, I mean, you are an anatomical mystery to be solved. We have a lot more
Yeah.
information now than we did 10 years ago. Now we have very
Right.
clear things that we need to look at. And if I were in your shoes, I would absolutely want somebody to study my muscles and let's see what we can do with my muscles. I mean, you may just need a pessary,
Mhm.
a pessary, which is an object that you put inside your vagina, will put everything back in its right position. And while it sounds creepy, it's not creepy. And in fact, a lot of young athletes use them
Yeah.
when they compete
Yeah.
at the Olympics. So getting something in
Well,
there to put everything back in its proper position might be life-changing for you.
well, I've had a hysterectomy, so what else would I lift up?
Your bladder.
I don't have a cervix. I mean,
Well, your bladder and your cervix.
yeah.
I mean,
yeah.
it's just one potential piece of the puzzle. With the rectocele, I don't know. I mean, they may need, you may need another surgery to kind of get things in their proper
I
position.
think I really do need surgery. I've put it off for so many years.
Yeah.
And then this year I was going to do it, and then we had the pandemic.
You had COVID. But I think I mean, if you, the whole
other thing. Oh, sorry.
Well, no, I'm just saying that the endometriosis is really interesting. I mean, I think it'd be really interesting to have a cystoscopy. Just, I mean, not a hydrodistension, but just a cystoscopy. Maybe just.
I have, but they don't say anything.
How long ago did you have one? How long ago did you have one?
Just last year, and they said my bladder looks fine.
Okay, well then that's good news. So then we don't need to worry about the endo in your bladder because they would see it in your bladder.
You think so?
Yeah.
Oh, okay.
They would see it.
Well, I don't feel fine.
Yeah, but the good news is, see, remember, it's all about kind of a checklist of checking things off as we try to figure out what the hell's wrong. So the good news is that your bladder wall looks normal and you don't have endometriosis pushing into your bladder. What you do very clearly have is very severe muscle dysfunction because you have a rectal prolapse and you've got a variety of prolapses going on.
Right. And I also have the atrophy, urethral atrophy.
Right. And what are you doing about that?
I do have some estrogen cream,
okay,
estradiol or something, and I put a little bit of that with a little bit of lidocaine gel.
Okay.
That's for that area, and I use both.
And has it helped?
Yes, it does help.
Good.
It's helped a lot ever since you told us about it.
Yeah.
I started using it. Yeah.
Well, I mean, anything that we can do to improve your skin quality is important. And it's just really sad that doctors don't explain to women as they get older to look for those classic signs of estrogen atrophy. Urethral irritation is the first thing they should have told you about. They should have told all of us about. So we're often in the position of having to educate ourselves and then ask them, which is ridiculous. But you're in better shape. You have a beautiful smile. You've got energy today. I'm so glad that your pain medicine is at a good point. I just want you to start adding. I think it would be very important to add some mindfulness in there to try to make sure that your nervous system doesn't get wound up to intensify the pain. So doing some guided relaxations every day, and that would be good for your muscles. We just want to calm it. We want to calm everything down. Okay.
Okay.
All right, hon. Nice talking with you. You keep in touch, my dear.
Thank you, Jill. I sure will.
Okay. Talk to you later.
All right. Bye.
Bye-bye. Hello, my friend Lisa in Houston. Are you there? Can you unmute yourself?
I did.
There you go.
How are you?
Hey, look at this. I keep a lot of stuff. I keep a lot of clothes in bins. This is one of my old tennis suits.
Oh, it's so cute.
I just woke up one day and going, hey, I wonder if I can still fit into some of my old tennis gear. And I saved 2 of my outfits, and it's cotton, and it feels good, so I'm wearing it.
Well, that says a lot because weren't you playing in college?
I was playing, and I still have all of my old sundresses from college, from high school and college, and I can still wear most of them. So I just try to save. I save things that I like. Well, how are you doing, hun?
I'm good. I just wanted to say a few things because I was listening to some of the earlier people who spoke. So Sarah, and she logged off the Zoom call, but and I feel really bad for what she's going through, but I think it's, well, her husband's a lawyer, as I am, and I think it's smart that she's pursuing some legal compensation. But I'm on some other IC websites, and a lot of the women are asking questions about, because the law firms are starting to send letters out to people.
Yeah.
And I don't know how they get the people's names, but they're sending letters out. And so one woman got on and asked, for advice if people thought she should pursue legal recourse. And now somebody answered before I did and said, no, you shouldn't. The lawyers take such a big cut. You should just try to settle yourself. And I got on and said, well, as a lawyer myself, I think you should at least call, because it doesn't cost you anything to talk to them. And, there's a lot of law firms out there that are doing this. And I think you should be one that's handling a lot of cases.
Yeah.
Because I forget the name of the one that you've had talk, but
yeah, there's
quite a few out there. And
the website for anybody listening, elmoron.org, elmoronlawsuits.org is a group of 3 firms that have filed over 50 cases so far. elmoronlawsuits.org. And that's
okay. I didn't know that. So I directed her to your website.
Yeah.
Your
Yeah.
overall website, because I couldn't remember the name. I've sat in on a couple of those Zoom calls with the law firm, but I couldn't remember the name of the firm. I think there were 2 on the second call. But, I felt badly because the truth is you're much less likely to get any kind of reasonable amount of compensation if you try to do it yourself.
Yeah.
And even after the lawyers take their cut, number one, you're going to get more money, but number 2, it's going to be so much less stressful.
Yeah.
I mean, it's just let the lawyers handle it. That's my view. So just FYI, there's a lot of other IC websites out there, Facebook pages out there, and there's a lot.
Yeah.
And I'm on like 5 of them, and I get very frustrated when I see what goes on and what people say. It also interested me that Sarah said that she suffers from colitis, because so do I. And right now my colitis is way worse than my interstitial cystitis, which is in remission. So I wonder to what extent there is a connection. I know there's a connection between IC and IBS, and people always talk about IBS, but you don't hear people talking too much about colitis. But my nephew, who's 33, was just diagnosed with ulcerative colitis, and I have colitis, and his father has colon problems. So I think colitis is also very genetic. And I've talked to my GI doctor about it, and he said the kind of colitis I have, there's been so little research done, they don't know, but with ulcerative colitis, yeah, they're pretty sure there's a genetic disposition. So
right.
Genetic was what he said. And then speaking of links, I wanted to know whether you would put a link out on some of your pages about the article that you put up when you were talking to Sarah.
Sure.
About the new how they've shown that they think they can reverse the Elmoron issues. That would be amazing. Of course, that'll impact roots, but it would be way better. I mean, anybody would rather have their eyesight back than get money.
Yes.
There's no question about that.
Exactly.
So I'm interested about that. But otherwise, I'm out on my treadmill today. I walked too far yesterday and my back hurts. So I thought, okay, no treadmill today. I'm just going to log into Jill's meeting from my office. But yeah.
Well, thank you for your insight. I mean, the lawsuits are. So I was in a lawsuit for, I got laid off because of my IC, and I was in a disability discrimination lawsuit for 5 years against my former employer. And who told me, number one, I came from weak stock. She's completely insulted my family. She, I made the mistake of, I'll tell you, honey, my ex-boss at that time was an ex-nun. She had just left the nunnery, whatever you call it, and it was her first job, not as a nun. And she didn't believe. She kept saying, you just want now. And guys, I was a manager. I was a senior manager. I was doing fundraising for a nonprofit. And so the IC hit, and it was really bad. And I had to go out on leave so that I could have all my testing done. And she just said, you want to work from home. That's it. You don't want to be here. You want to work from home. I was like, no, I have to pee every 30 minutes. She goes, you look healthy, Jill. I don't get it. Can you explain it to me? And I said, it's like a bladder infection that never goes away. Have you ever had a bladder infection? She goes, no. Yeah. And then I said, and she's like, I don't get it. You look fine. And I'm just like, in my brain, I'm going, God, how do I describe this? It's like the world's worst bladder infection that doesn't go away. And then I finally go, it's like honeymoon cystitis. Okay. She was a nun. She's like, what's that? And I go, well, it's something, it happens to some women when they're on their honeymoon, when they get really abraded down there and it just hurts really badly. And so and from that moment, I was the dirty sex girl in her eyes. She goes, oh, it's just about sex. And I'm like, no, I'm not in a relationship right now. It hurts too much. And I mean, I had a boyfriend, but I wasn't having sex with him. I hadn't had sex in like a year. And so from that moment, I was a dirty sex girl, and I was fired because I was the dirty sex girl. And she admitted that she parked her car on my street to watch me with my boyfriend to prove that I was having dirty sex in our depositions. Which of course was impossible. I think the hardest part about a lawsuit is that it's about the truth. It's you're walking in as an innocent victim. You've done nothing wrong. You're hurt. You're hurt. And sometimes a lawsuit is about who has the most money to pay to support their lie. And you might, and I think you would probably disagree with that. So on the other side, they tried to prove that I was the dirty sex girl, that it was all because I was having too much sex, et cetera, et cetera. And so I just found as the innocent victim that I just tried to tell my story. I explained how it happened and that I wasn't having sex at the time. And you have to stand strong for yourself. And there are moments when it's very depressing and they challenge you and challenge you and challenge you sometimes. I was in deposition for 4 years. My deposition was longer than this because they just tried to catch me to prove it. And so it took a lot of resilience and determination to get through that process. And as you said, I think the value of working with the law firms who are already doing this is that they can protect you. I was working with an independent attorney, and that was much harder because he just wasn't that good. We did settle in the end, but it took 5 years to get there. So,
well, see, that's another risk of, like this other woman advised that if you join a class action suit, you have to agree, that you won't pursue any personal suit. Well, that's true, but I learned from watching having the law firms on, which was very interesting to me, of course.
Yeah.
That they're starting out with these suits as separate suits because the facts are also different.
Right. Right.
And then if the court decides to consolidate it into a class action suit, then you have the option to opt out. They have the ability to opt out, but who would want to? Because then you go through what you went through.
Right. Right.
Whereas if you hang in with a class action suit or with the law firm that has 50 other suits, I mean, it's like when my husband died, and I'm a lawyer, but I hired a lawyer to handle his estate. and she did everything for me. All I
Right.
had to do was show up in court, and I didn't want to do that myself.
Right.
Why would I want to do that myself?
Right.
You know, it's too stressful.
I mean,
So-
I think that, you know, I believe in informed consent, and that's why I was the person who introduced the whole Elmeron issue. That was a hard decision for me to make. Well, no, it wasn't hard. It was easy. I mean, patients need to know. They need to know the risks. They need to know the benefits so they can make potential benefits so they can make good decisions. But there's just a lot of tenacity when you're in a lawsuit. I mean, and that's why I think anger is a useful emotion right now, because when you're angry, you take action. When you're angry, you're willing to fight. And I want every patient to fight. I want every patient who suffered eye damage to fight back. And because I think that they deserve compensation for what they're going through. And if most importantly, that the company needs to be held accountable for the data and for what they knew and what they didn't know. But, you know, it's just, I hate the fact that it's adding stress to people's lives. That's why I started working with the law firm that I thought was going to be the most beneficial for them, if that makes sense.
Yeah.
Yeah.
I think it's a great thing you're doing, and wow. One last question. I wonder if it would be, you can tell it's getting dark here. I wonder if it would be beneficial. This is a selfish question, but may affect other people.
Mm-hmm.
Jaw's bothering you.
No, just my sinuses. Yeah.
To try to do, to try to find out if there is an overlap between IC and not just IBS, serious bowel conditions.
Well, I'm going to ask Ruth. If anybody would know, Ruth is, and she's the one doing the 23andMe research studies. And right now
I treated with Ruth, so.
Yeah, but did you do the DNA testing? Because the DNA testing's all new. She's gone in a totally different direction.
Yeah, I talked to her right before she retired, because when my IC came back, I was treating with her and talking to her, but
okay,
I forget what testing we did, but yeah.
Did you do?
She's in Austin now. I figure next time I go up to Austin to see my brother, when he'll let me in his house, because of COVID, he and his wife are, but so am I. I mean, I haven't, you know, they're being like me, very, very careful.
Yeah.
But when we get our vaccines, because we're high up the list, because we're old, when they finally let me in their house, I'll go visit, and maybe I'll try to meet Ruth.
I just think the whole DNA work that she's doing is really interesting. Really, really, really interesting. So anyway, all right, Lisa.
Okay.
Keep in touch, my friend. We should play tennis virtually. There's got to be some sort of a game online that we can play tennis against each other.
Well, I'm playing now once a week.
Nice.
Last week we couldn't play; it was too cold, so we're switching to afternoons. Because it's warm enough to still play in the afternoons here. So I'm playing. So if we can ever get together, we'll play.
Absolutely.
Beat me like crazy, and you can still fit into your old tennis outfit. So anyway, all right. Thank you.
Okay, hon. See you later. All right.
Bye.
Laura.
Yes.
Have I talked with you yet? No, I haven't.
No.
Hey, girl, how are you feeling today?
I'm in my PJs because I was in pain earlier.
That's okay. We can all be in our PJs. It's okay.
Yes, I'm on because I'm new at this.
Okay.
And I had it in, it's already been a long time that it started off thinking I had a UTI at that time, which was last year. I was going to the gym. I wanted a better, lifestyle, because I have gained a lot of weight. I noticed at that time that I was having like symptoms of a UTI. So I have even quit soda since that long. I've been without drinking any caffeine for a year and 5 months.
Okay.
And,
good job.
So I always thought it was a UTI. Like around March of this year, I had my regular pap with my women's doctor.
Okay.
I did mention it to her again that I was in that pain after I would urinate, or even sexual intercourse would make it like burning, you know.
Yeah.
And she would always just give me UTI medicine, and literally she gave it to me like 3 times in a short period of time. It didn't work. I was kind of like, well, what's going on, you know?
Yeah.
I kind of really didn't pay much attention to it after that. And then especially with everything with COVID, I was more worried about that, to
Yeah.
be honest.
Oh, yeah.
And it was like around in the summer that I was in a lot of pain. My back was hurting really bad. And at this time, I still didn't know that I had IC. I went to the ER, and they did a urine test, that's all they did. And they told me I was fine. And I'm like, well, how am I fine if I'm
Yeah.
in really bad pain? My back I couldn't take it.
Yeah.
It was, I
So,
literally thought I had like a kidney infection or something. So I did make an appointment with my regular doctor, and they did they did another urine test, and then they did an X-ray, and they had said that they would call me literally like 10 days, nothing. I called back, and they said that they forgot to call me back with my results. So I said,
typical.
well, I'm in a lot of pain. I want to know what's going on with me. And they told me everything came out fine. You're constipated. That's what they told me. And I thought to myself, like, no, this
No.
pain is not because of constipation. Like, I was upset
Yeah.
because I feel like till this time, like, I feel like if I am not getting answers. I mean, I don't know. I might be wrong because I did get a new doctor. But at that time, I told them, like, I guess the nurse heard me that I was upset because I told her, well, what do I do? Like, I am in a lot of pain. You're telling me I'm constipated. What else can I do? And at that time, like, I was burning from my stomach too. It would burn me. That's how I felt, that it would burn. And then especially with my back pain. And they sent me to a urologist here in town. I do live in a small town. So I said, you know what, let me try it here. I went with them. It was around August, the first time I went. And then I never got to see the doctor. I would only see the nurse practitioner, which was kind of odd too. The only thing was she did give me Elmeron and other medications. And I felt like if it wasn't working, I did take it for a month. And then I saw her again, and she gave me more medication. And then I saw her again after that, the follow-up. And she said she recommended me to get a cystoscopy.
Okay.
And I did get that. They did put medication in my bladder. I literally felt the pain in 3 days, like if nothing was helping. So I called her and I told her, you know what, I'm in a lot of pain. I can't take it. I didn't know what was going on, you know?
Yeah.
She told me what I have, but she never explained to me more like what I should eat, nothing like that. She just kept telling me, drink a lot of water, drink a lot of water. At this time, I was in desperate pain. Like, I went to the doctor and she called me then. She didn't call me right away. She took days. Like I said, that by the time she called me, I was already at the doctor telling them I was in a lot of pain, a regular doctor. And all she told me was, take more Elmeron. Because whenever I had seen the regular doctor, obviously, to do the procedure, not her. At the nurse practitioner that I was seeing, she's not the one, obviously, that did the procedure, right? So when I saw the doctor and he did the procedure, he did tell me to stop taking Elmeron and start taking other medication. I took the medication and nothing. And I actually changed to another doctor in another town because I said, I'm not getting any help. And I feel like when I do call them, I feel like if they just give me a kick in the butt and tell me, here, take this. And she never told me about my diet, or I don't know nothing about this.
Okay. Okay. So let me stop you here for a moment. I want to ask you a bunch of questions. Okay. So number one, how old are you?
I'm 30.
You're 30. Okay. And this started how long ago? Last year or this year?
Well, the burning in my when I would urinate, after I would urinate and stuff, that I did feel it since last year.
Okay, so describe for me the burning. Is the burning inside of your body or outside of the body?
Well, I do feel the burning inside my bladder, and I feel it whenever I feel it outside. I feel it like in the inside.
Is it in your urethra or is it deeper in your bladder itself?
Well, I think both, because
So
my stomach, even when I would touch it, it would.
Okay. But so when you're saying stomach, though, you're referring to your abdomen. You're not referring to your stomach that contains food. You're referring to your abdomen.
Yes.
So
abdomen.
is your pain centered? Is the burning centered, like right above your pubic bone, or is it to the left or right of center?
Sometimes I feel it all.
Okay. Okay. Is there one spot that always hurts all the time, or is it kind of diffuse? Is it?
I kind of a lot of times I did notice that under my belly button.
Okay. Okay. If you put your hand underneath your belly button. All right. So here's my belly button. Okay. So put your finger here, just right underneath your belly button, and you push in a little bit. Does it hurt?
Oh, let me see.
Don't push a lot, just a little tiny bit. Is it painful when you push in right there?
No, not right now. It doesn't hurt.
Okay. Okay. I want you to do something different. So your hip bone. So here's your hip bone right here. Put your fingers right on the inside of your hip bone and push in. Is it tender?
No.
Interesting. Do the other side. Push in on the other side.
And then right now I have to pee, so I don't know if it has to do. I do notice when I do get the pain, and it hurts on my sides too.
Okay, because those are pelvic floor attachment points. Hon, if you need to go pee, it's okay. You go pee and I'll be here. If you need to run to the bath, go for it. It's okay.
Okay,
I'll come back and look at some of the questions. Hey man, if there's any place you guys can go pee, it's during one of my meetings. It's fine. Kara says, Jill just jumped on for a few minutes. I saw you have sinus issues. Wanted to share what helps my sinuses. It's from Garden of Life Company, and it's for sinus. It has butter bar in it. Seems to help. Okay, I'll write that down. My sinuses got fried in the fires. I mean, I just think they're black inside from ash. God only knows. Garden of Life. I'll write that down and check that out. And I'm also grinding my teeth at night too, and that's not helping. All right. Robin said, last time I got eye punctal plugs, they asked me what and how Elmerin did to me. I said it gave me the worst headache than a migraine with no relief and migraine meds. I didn't say anything about the lawsuit going on, and neither did they. Interesting. Melanie goes, ha ha ha, dirty sex. Yeah, that's when you try to explain bladder pain to a nun. Yeah, didn't work so well for me. I was not being smart. I was just desperate. She was pushing me. I just couldn't come up with another way of explaining what IC felt like. Okay, so Sherry, so the pain on the inside of the hip bones is muscle pain. That's a muscle attachment point. The pain below the belly button, that's also muscle pain. Those are muscle attachment points, or they're just general muscle tension points. Can you remember any event that happened before this began? Did you fall? Car accident? Trauma? A great trip with a lot of sex? Can you just remember anything unusual that happened in the 6 months before this all began?
Well, I've always been very active with my kids. Well, not now because of COVID, right?
Right, but a year ago before this happened, yeah.
I do. I don't know if it has anything to do with it, but I do have a prolapsed uterus.
Yeah, that has a lot to do with this.
Yes.
That
And
has
I
a
have
lot to do
told
with it.
them, when I would see my women's doctor, I would always tell her and tell her and tell her. And I felt like if she would always just blow me off, like, oh, you're fine. And oh, you're fine. And I'm like, I don't feel fine. I mean, I could feel it, you know?
So uterus falling is you feel like a hard lump by your vagina?
Well, the odd thing, like right now I'm fine, but there's days that say I go to the grocery store. We are a big family, so I do buy a lot of groceries. Walking a lot and carrying like the waters and stuff.
Right.
When I'm done, I feel it more.
Right.
Mhm.
How many children do you have?
5.
Holy moly. So your pelvis has been through 5 pregnancies.
Yes.
Did any of those when was your last baby born?
He's gonna be 5 on the 22nd.
Okay. And how was his delivery? Did you have any bad deliveries?
No,
Okay.
all of them were natural and good.
Okay. Did you have an episiotomy? Did they have to cut you at all?
No,
Okay. So they didn't cut your opening to make it a little bit bigger for the baby's head to come out?
no.
Did you suffer any tears, any muscle tears?
Yes, not with my last one, but I think with my 3rd child.
Okay. And are you still having periods now?
Well, that's the thing. I was telling the new doctor that I went to, the urologist, because she asked me the same thing, and I told her, well, right now I've been on birth control pills because of it, because I was always irregular. Like when I would start, it would be for a long period of time that I would bleed, which would scare me because I would be like, what the heck, you know? But as soon as I started the birth control pills, it has calmed it down a lot. And I'm kind of scared because I'm like, I mean, I don't want to be on birth control pills for the rest of my life. You know what I mean?
Interesting. I would have thought the birth control pills would have made it worse rather than better. So, did any of these doctors do a pelvic floor assessment?
No.
Well, that's the first piece. The first piece of this puzzle. Any good IC doctor, your very first appointment would do a pelvic. With your history of a prolapse, it's literally the very first thing they should do.
How does that work?
Well, they just touch your muscles. You know, it's about. I mean, listen. Let me show you this. I want you to really understand this. So here, hold on a sec. Let me get my. Hold on. I got my bladder. I got that. Where's my bowel? The bowel is. Where's my bowel? Oh, here it is. Okay. So here's the thing you got to understand. IC. We don't think of IC as a bladder disease anymore. We don't. It's a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved. And so we're now doing these subtyping. We're trying to understand the different variants of IC so that we can give you the right treatment for your unique case of IC, right? Because everybody's different. And so for some people, it can be
He did. I'm sorry.
No.
The doctor, when the helper of the doctor, he did check me.
Yeah.
And he even put a catheter to see if I was letting all the urine out.
Okay. But back to my point for a moment. So here's the issue: is the pelvis is a very small and confined space that has a lot happening in there, right? And so Western medicine fails the IC patient because doctors stay in their box. Urologists like to stay in the urinary tract. Gynecologists like to stay in the reproductive tract. Gastroenterologists stay in the bowel. They don't understand relationships. They're not looking at relationships. I know there's one thing we know is that these organs talk to each other. And the muscles are involved. If the muscles are messed up, the organs are going to get messed up. If the organs are messed up, the muscles are going to get messed up. And then there's going to be a lot of nerve damage, nerve issues going on too. But I really want you to see this. So look, this is a life-size pelvis. So this is with all the innards taken out. So here's what you can see is you can see the muscles. And so generally what they will do is they will put their finger in and they will just touch muscles, right? So first thing we want to know is, are these muscles what the shape of these muscles are. But I want you to look at how crowded it gets and how hard it is to distinguish. So the first thing we're going to do here, I got to put my levators on here. Hold on. Okay, so the first thing we're going to do is we're going to put the uterus in. Hold on. Okay, so look, so now we have the vagina. Whoops, darn it. Sorry, this is hard to hold on to. We have the vagina, we have the uterus, and we got the ovaries, right? Then we're going to put the bladder in. Okay, so look, so now we've got a bladder in there. And you can see here's your pubic bone, and the bladder extends slightly above the pubic bone, right? That's why you can push in and it hurts. Then we're going to stick the bowel in. And in the end, look at how crowded this is. There's a hell of a lot happening in there. But then you've got nerves going through from the spinal cord down to the legs, and you've got blood vessels going from the heart down the abdomen and down through the pelvis and into the legs. And so in many cases, the pain is coming not from one thing, but from two things. There's something pushing on something or something influencing something. And fundamental principle number one is if your muscles are screwed up, your bladder's going to be screwed up. So if your muscles are weak, you're going to have prolapses. If your bladder is starting to fall out of you, sometimes it folds over. You know, normally your bladder is kind of like this, but with a prolapse, it might be like this. You know, part of it's flopping over, and then you can't empty your bladder well. That could be pain. Tight muscles, if the muscles are too tight, then it's going to restrict blood flow, because the blood vessels go right through the muscles to the organs. So if these muscles are squeezing down, then they're squeezing down on blood vessels. And all of a sudden, the blood flow can't get there. So we're seeing a lot of what we call ischemia, which is basically just oxygen deprivation because there's not good blood supply.
Does that cause dizziness?
Cause what?
Dizziness.
Are you having moments? Is it associated with bowel movements? Do you notice when you have a bowel movement, you got a wave of dizziness or a wave of vertigo?
No, I noticed that just like all of a sudden I'll get it.
Okay. You should tell your doctor that. I mean, they certainly they should be doing they need to do a full workup on you. Number one, we need to know what the hell's going on with your muscles. Number two, we need to know what's going on with your bladder, but they looked at it and your bladder looked pretty normal, right?
Mm-hmm.
Okay, so we don't need to worry about anything catastrophic with that. I would want a next generation urine test just out of curiosity, just to see if there's anything unusual like a mycoplasma or a ureaplasma infection, something funky that's difficult to culture. So you could ask for a next generation test. What we find that patients often have a lot of fungus in their urine during flares. I would look to also just planting the seed on mold. If there's any black mold in your home or mold in your home, that has been known to trigger bladder symptoms of frequency, urgency, pressure, pain. So look for, if you find other people in the family are getting sick, especially with the dizziness, nausea, vertigo, anything like that, look at mold, just out of curiosity. I would want a urine cytology test. Are you a smoker? Did you ever smoke?
It's been years.
Okay. Well, I mean,
urine. What did you say the last one? Urine
cytology, CYTOLOGY. I mean, we're just going through the list. We're just checking stuff off.
Yes.
We're just trying to focus on the fundamental problem here.
She did give me a new medication, and then one of them that she gave me, I already had it at home, which I didn't even notice till not ago, because I barely saw the new doctor on last Monday. And she did give me sulfenacin,
Okay.
I believe,
Okay.
and phenazopridine
So the
for
pheno,
that.
that's the stuff that turns your orange yellow, and it will kind of your urine, it will turn your urine orange,
Yes.
and it kind of numbs your bladder wall. The other one I think is tolterodine, which might help with some frequency urgency. Did she do it? Did she do a muscle assessment? Okay, you gotta ask for that, or go to your gynecologist and get your muscles checked. I mean, that's such
Yeah,
a
well, she's urologist, gynecologist. And
okay.
the only thing that they did was they checked me, and they told me, does it hurt here, here? And that's what they did.
Did they identify the prolapse?
Well, he told me that it looked fine, but I told him, I mean, there's days that it scares me because I could feel it.
Is the pain the worst when you prolapse the most? Do you
When I'm
associate?
prolapse, yeah, it hurts.
Okay.
Like when I get the burning in my abdomen, my back, I can't take the pain. It's very.
Well, I think it all begins and ends with your muscles, and we have to really try to understand what's going on with those muscles. You went through 5 pregnancies, 5 deliveries. You did suffer some muscle tears. I think that that's an important and missing piece of this puzzle. I don't understand the dizziness, and you definitely need to tell your doctor about the dizziness too.
Yes. Yes, I need to.
How often is that happening?
It doesn't happen like super often, but I do get it like every once in a while.
Is it like just a little wave of vertigo and then it goes away, or are you like literally holding on to something because you're so dizzy?
Well, this last time, I had gone up from the bed because I mean I'm always going to the restroom, and I said, well, maybe I got up too fast. So yeah, I said when I was done in the restroom, I came back to sit down, and again, like I felt dizzy, and it kind of felt like it felt ugly, and it was already time for the kids to go to bed. So I go tell them that it was time for bed, and I did feel like if I was gonna fall.
So that it could also very easily be a medication side effect.
Okay, but that's the thing. I that's the first thing my husband told me. But I told him I did feel it even before.
Well, I mean, you are an anatomical mystery to be solved, and all we're doing is guessing. And you deserve far better than a guess. You need facts, and so, I think I would want to know what's going on with my muscles. You've got to be better at describing it, though. Make sure you tell them that it happens after a full day's work, or it happens when you lift something.
Her that I did. I actually wrote down everything before I went because I know sometimes I forget or I'm in a lot of pain, and I did write down everything, and I did tell her that too. But she said, well, first let's try this medication, and then we'll talk about the prolapse uterus.
Okay. What did she say about that? Did she recommend surgery? Did she recommend Kegels?
She didn't say nothing. She just, that's all. It's because I talked more to the other doctor that was there, the helper, and that's it. Like they really didn't explain to me much. And like I'm kind of curious too on the diets because I mean they just gave, but I really don't know much like how to read it from a box, like a cereal box, or I don't know what to look for or what to avoid,
Well, you want to avoid the strong acid. I mean, okay, there's the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved. They're both involved because they cannot not both be involved. They are intricately connected. So for some people, IC begins after a bladder injury, like a chemical injury, like chemotherapy or drinking too much diet soda. And because their bladder's screaming in pain, their pelvic floor muscles get tight to protect them. That's a guarding reflex. So these are the patients who are going to be very diet sensitive. In contrast, the bigger group of people, their symptoms begin not with a bladder injury, but with a muscle problem. And usually what we see is a series of muscle traumas over time. And so here you have a completely healthy bladder, but you have no clue that your muscles are injured until one day you just have frequency urgency, right? And you go, I must have infection. You call the doctor, say, I think I have an infection. The doctor goes, well, let's give you some antibiotics. They don't work. You go back to the doctor goes, let's do a culture. They do a culture. Your urine's clean. We don't find anything. Then they give you some overactive bladder medication. They say, maybe you've got overactive bladder. They don't work. Then they say IC, maybe you got IC, and they give you Elmeron in the diet. And ultimately, in the end, those don't really work either. And the reason why is because this patient has a healthy bladder. What the problem is they've got messed up muscles. And the messed up muscles are influencing their bladder in some way. So for many patients, it's about tight muscles that are squeezing the bladder and squeezing the blood vessels. And it's very hard for the bladder to be healthy if it is being compressed and or if the blood vessels and the nerves are being compressed, right? Or in your case, your muscles might be too weak and that's causing everything to drop down. But for the tight muscle patient, our therapeutic priority is to restore blood flow. There's a blood flow abnormality. The bladder can't be healthy without good blood supply. And so what they're going to do with physical therapy is they just follow along the length of the muscle and they try to get the muscle to flatten and relax. The other way of doing it, other way of thinking about it is, so here's a bladder. This is a small bladder. So it's being squeezed. So we're just going to try to open it up, right? And we're going to try to relax those muscles. But if you've got a prolapse, what's happening is the bladder is starting to fall. And so it may be that you're not going to be able to lift anything heavy for a while. If they can get the bladder into the right position, you might be able to do a Kegel exercise to strengthen those muscles. Or they might need to do surgery to try to prop up that. I mean, after 5 pregnancies, and I always thought I would have 5 children. So I really envy you, your 5 children. I think that's wonderful. And I'm sure you're a fabulous mother. The challenge here is just the wear and tear that 5 pregnancies take on the pelvis. And the muscles could be stretched out so far, too far, that you cannot use an exercise to rebuild it. You have to do the surgery so that they can get in there and put things in their proper position. So burning, I guess your symptom that's interesting to me is that it's a burning sensation. And we associate a burning sensation with tight muscles. Muscles that are working hard are tight. They build up lactic acid and they burn. So I'm confused. I don't think you have enough information to really understand what's driving your symptoms because we really don't understand what's happening with those muscles yet.
Yes. When I went even to the new doctor, I feel like if everybody just does a urine test or they go by what I'm telling them and that's it.
Well, that's why you never walk in and say you have IC. You need to walk in and have your symptoms. Say, doctor, when I lift something heavy, I get a burning sensation in my pelvis and I feel something hard. What is that?
Okay.
And they should be able to say, we know exactly what that is. That's a prolapse. But you've got to really focus on the weird symptoms, the unusual symptoms. Like, do you feel a buzzing? Do you feel a vibration? Do you feel, what makes the pain worse? What makes the pain better? What makes the pain worse for you?
Yeah.
Lifting things makes your pain worse, correct?
Yes.
Okay.
Lifting and walking long distance.
Right.
Also,
and so that's all muscle pain. That's not bladder pain. That's muscle pain. It's just the muscles right next to your bladder. Do you flare with foods?
Yes.
Okay, so muscles that are tight will eventually cause the bladder wall to break down, and that's why people with muscle issues can have bladder wall issues too. So
Yes, and I don't know if I've also been having acid reflux. I don't know, like heartburn and stuff. I don't know if that has anything to do with that, but I have felt that way too.
Well, some of that can be stressed. I mean, we're just all under stress. Look for Gaviscon, Gaviscon. Let me go get a bottle of it. It's perfect for GERD. Hold on. Gaviscon is a lesser known stomach medication that is often suggested for people who have GERD because it creates a foam on top of your stomach that prevents it from going up into your esophagus and causing irritation. So this is the go-to in our house. This is what I do if I start feeling weird. So Gaviscon is better. It's better than Mylanta, and it was the gastroenterologist who told my father and I that if you're starting to feel GERD, you want that foamy cover on the contents, and that's what Gaviscon does. And it tastes good. I mean, it's just a capsule. I mean, it's just a tablet like Tums, but it doesn't have the nasty taste that Tums has, and it doesn't have artificial sugar in it.
Okay. I have another question.
Yeah.
Where can I get, like, I want to find like good recipes of this. I've been looking and I still
go to our diet section, and we have several websites. I have another website called icdietproject.com. Tons of recipes there. But you can find links to all of them right on our main website. Just go into the diet area, and I've got links to all of them. We have hundreds and hundreds of articles on food with lots and lots of recipes. And I also have a cookbook called the IC Chef Cookbook that's available. And then we also have Confident Choices, a cookbook for IC and overactive bladder. So we have a couple of different really good cookbooks too that will give you some ideas. I'm just not convinced that I have no clue if you're bladder wall primary or pelvic floor primary. So you've got some more work to do with your doctor.
Yes, because that's what I was kind of like concerned, because that's the first thing I did mention. I'm like, I do have a prolapsed uterus. I didn't know, I mean, I don't know nothing about this, and sometimes I feel dumb because I'm like, I don't know. But I did mention it to them, and I told them, I don't know if it has something, and I kept mentioning it to him, and they told me right away, well, let's not focus on that. He said, first, let's try the medicine. That's what they told me.
Well, and if the medicines are having no effect, then you get to say that they're not helping. They haven't changed anything. And what the American Association says is if you're not responding to bladder therapy, stop, take a step back, look beyond the bladder and see what we've missed.
And yes, because I did even mention, well, that's the thing, like, because he's like, well, your uterus seems fine right now, like nothing feels. And I said, yeah, but it doesn't happen every day. It happens, whenever I do a lot, or when I clean my house, when, something, when I do a lot of activity, that's when it happens. Well, it doesn't happen every day.
And when that's what we say. If movement triggers your symptoms, and we're always going to be looking at muscles. Okay.
I will definitely mention it again when I go.
Yeah. And in the meantime, you can get the basic information. No coffee, no tea, no green tea, no black tea, no soda, no chocolate right now. You can do white chocolate, but don't do hot chocolate or Hershey's Kisses or anything like that. Do white chocolate. Look at vitamin. Be careful if you're taking a 1-a-day vitamin. Those can be very irritating.
Oh, that's another thing. I did stop my vitamins because I did read about that, but I'm like, I don't know what I could take.
Well, I give your bladder a break for like 6 weeks,
Okay.
4 weeks, 6 weeks. I mean, did you have a doctor tell you have to take a multivitamin every day, or are you just doing it just to be healthy?
I just do it.
Okay, so we just back off on it for a little bit and just give it a little bit of time. Give your bladder time to calm down. And it'll be interesting to see where you are in a couple of weeks. But again, the prolapse is concerning to me. I have to wonder. Your bladder is attached to your vagina with tissue, and so if your vagina is starting to fall, then that might be pulling your bladder downward a little bit, which could explain some of your pain.
Okay.
Okay. All right, Hannah.
Yes,
I wish I had it. I wish I had a great answer for you. I think it's the doctor has got to give you the answers. And again, the fact that movement is triggering your pain points specifically to muscle. It does not point to bladder. If it were just your bladder, movement would be fine. So, okay.
Okay. Thank you so much.
Okay. You keep in touch. I want to hear from you for sure, Laura. Okay.
Okay. Thank you.
All right,
Bye-bye.
my friends. I'm going to shut down the Zoom meeting. Thank you. Thank you, Lisa. See you later. All right, we are now coming back to Facebook and YouTube. I don't even know how many people are left. Hello, my friends on Facebook. Sorry about that. All right, and there we go. We are now on YouTube too. All righty. So what did I miss? What did I miss? Here, give me 1 sec. I'll be right back. Hey, if you got questions, I'm ready to take them. I just need to get a thing for my hair. Are y'all in the holiday spirit yet? Going to be an interesting holidays, but you know what? We are tough cookies. We are going to get through this together. Here, I just got to put my hair. Hold on. Okay, there we go. Seriously, COVID hair is real. It is real. Carrie says, my bladder now leaks every day. Is that normal when you've had IC for 10 years? No, not at all. That is a sign that your muscles are probably also involved, Carrie. Your incontinence is not part of interstitial cystitis. Incontinence can be because your muscles have gotten weaker as you've gotten older. You know, if you're menopausal or postmenopausal or even perimenopausal, that loss of estrogen is going to influence your muscle health. And so what happens is your muscles tend to get a bit weaker and weaker. One of the things that happens, I call it milking my bladder. It started in my 40s where we'd sit on the toilet and I'd go and then I'd stop and I'd go, am I done? Nope. Go again. Stop. Stand up. Am I done? Nope. Sit back down. And that's a sign that muscles are getting a bit weaker with age. But if you catch it early, you might be able to do some pelvic floor physical therapy or some Kegels to really improve that. So you got to tell your doctor about that, okay? Rebecca says, I have a question. If your medicine was working well the past 2 years and you rapidly put on weight during quarantine and see your meds aren't working as well, could it be the weight gain? Yeah. I think stress. I think the stress of quarantine has been terrible for all of us. And when you're under stress, you are naturally tightening muscles, but you're also amping up your nervous system. It's wiring up your nervous system or winding up your nervous system. And a wound up nervous system has a cascade of effects. And one of the things that it does is it causes nerves to release irritants in tissue. It's called substance P. And so people flare under periods of high stress. And so I would guess that you're flaring from the stress and not necessarily from the weight gain. I think, listen, man, a cinnamon roll has never tasted better than under quarantine. My weight's going up and down. It went it went up about 10 pounds in the spring, and then I lost it about a month ago, and now I'm kind of working up again because I started eating a little bit of ice cream. But a heavy weight gain is certainly going to put a lot of more pressure on your pelvic floor. And so that would be an issue too. Katrina's asking, Teresa, Teresa says, for almost 2 years, I've been taking Sister Protect since I stopped my Elmeron. My problem was with the bladder lining. I also continue to eliminate my daily diet. Okay. I think that that's the right thing to do, especially if you've got estrogen atrophy, if that's what's driving a lot of this. Olivia says, still watching Jill, took 3 years, now finally no pain, managed now. I do have stress triggers I've identified to warn me in order to avoid pain. Thank you for starting this group. Oh, Olivia, I'm so happy, hon. I'm so happy you're doing better. Katrina, I don't know if you're still in here, that you are getting pain from reducing Elmeron. So this is when you want to maybe try adding a supplement. You know, Dr. Parsons and Dr. Theoharides appeared together at the 2006 IC Patient Conference in San Diego. And then they talked specifically, they were asked specifically about transitions. So for people who have to get off of Elmeron for one reason or another, generally what they do is they will reduce 1 capsule a day for a week. And then, so if you were taking 4, what Dr. Parsons said is take 3 a day and see how you do. If your symptoms come back, then we know the Elmeron's helping you. If the symptoms don't come back, then we know maybe the Elmeron's not helping you. So then he said, okay, go down to 2 a day for a week and reevaluate, and then go down to 1 a day to evaluate. So that was what Dr. Parsons said for people who were trying to figure out if they needed to take Elmeron for the rest of their lives. The second question is how do you transition from Elmeron to a Sister Protect or one of the supplements? And at the conference, what they said, again, is a 1-to-1 swap. So if you were taking 4 Elmeron a day, what they said is, okay, do 3 Elmeron and 1 Sister Protect for a week. See how you do. And then do 2 Elmeron, 2 Sister Protect, and then 1 Elmeron, 3 Sister Protect, until you can get your way off of that and over onto the other one. And of course, now we have so many more products other than Sister Protect that patients can try. And the Bladder Builder is the one that I think is the most promising, because that's the one that has the pain fighting ingredient in it, PEA. And so, you know, just know that back then we only had Sister Protect and Desert Harvest Aloe, and today we have so much more. Teresa on YouTube says, do I know anything about Sola for IC? I don't know what that is. Let's look. Sola interstitial cystitis. Let me look. Let me see if I can find it on the internet. Oh, Sola therapy is a gentle, non-invasive treatment. Well, let's look at this. Sola therapy is a gentle, non-invasive treatment that uniquely targets the most common sources of pelvic pain, pelvic floor spasms. Through a series of 2 to 4 gentle treatments over 3 to 4 weeks, Sola therapy can help relax your muscles, calm inflammation, and reduce nerve pain for lasting relief. So it is... it delivers therapeutic doses of painless light energy deep into the muscles of the pelvis. So activating light energy stimulates your mitochondria, the healing powerhouses within your cell, to help your body heal from the inside out. It's called cellular photobiomodulation. It can soothe tense muscles and promote healing. Each Sola therapy is performed in the office. It takes less than 5 minutes. The wand applies healing light internally directly into your pelvic muscles. You may feel soothing warmth. Many patients experience significant pain reduction. Sounds promising. I guess the question I would ask is, does the wand get hot? And is there any chance I can be burned? I mean, we're learning more and more about ways that we can relax muscles. It sounds interesting. They also do some deep penetrating heat, which I've used. That's been quite interesting. Patty says, have you heard anything about ashwagandha causing a flare? I added it and a multivitamin and flared. Girl, ashwagandha shouldn't cause a flare. The multivitamin probably caused the flare. I've never in 27 years had anybody say that ashwagandha triggered a flare. So I really doubt. Yeah, it was a vitamin. No doubt about it. It was the vitamin. In my opinion. That is in my opinion. Lisa asked, how long after being on Elmeron does the eye disease start? It can be within the first year. Although the research originally was looking at 15 years. If you look at the FDA, the new FDA safety warning about Elmeron and pigmentary maculopathy, they're targeting the 3-year mark. But they say in the new guidelines that there are some patients who report symptoms earlier than 3 years. And in our own survey of patients, we have patients reporting changes in their in eyesight in the first year of using Elmeron. So it sucks. But generally, though, the consensus is the more you take, the greater the risk. Allison saying her gut is really bad at the moment. How to sort it out? Yeah. Simple, fresh, healthy food. You know, we did a survey. I mean, I have to say that the great majority of patients who have called us asking for help have some sort of stomach issues. I mean, I've had a lot of stomach issues. I've had several gastritis bouts. And finally, I was diagnosed with gastroparesis, which is delayed stomach emptying, which means the nerves that control how food moves through, how soon food leaves the stomach and goes through the gut is different. And so gastroparesis is essentially delayed stomach emptying. What was interesting is that 95% of the patients who did our survey reported stomach issues. And generally it was gastritis, GERD, gastroparesis, and just constant stomach ache and stomach burning. In contrast, we have to separate the gut from the bowel. Irritable bowel syndrome is common in a group of IC patients. I mean, I have IBS. It's not active right now. It's very, very controlled. And we don't really necessarily, I mean, we know that chronic overlapping pain conditions is driving part of that we've got a wound up nervous system, and wound up nerves in the gut will trigger IBS. But we also know that our biome has been damaged by food, and the foods are diets today and antibiotics and all of that sort of stuff. And so I think a lot of what we have to do is kind of get back to good, simple, fresh, healthy food, losing the junk food and the fast food and the sugars and the carbs, and eating real proteins and real vegetables. Oh my God, I was supposed to make stew today. I was supposed to cook all day today. Oh my God, I forgot to do that. Dang. Okay. So, and also, doing a good gut flora is important. Bladder Builder does have some beneficial probiotics in it. Research studies have shown, the MAP Research Network, that the gut biome in the IC patient is not normal, that it is a bit abnormal, that we are missing some important bacteria, or the population is way down. And so doing a good probiotic is important, and mixing it up, not just doing the same probiotic, but lots of different probiotics, or just mixing it up every couple months so you're not just overpopulating one species. We sell Culturelle on our website. That's one. But generally, you want a probiotic that's refrigerated, like Solgar's Advanced Acidophilus is one of several options. Patty said, is ankylosing spondylitis related to IC? I don't know. I don't think so. But I could be wrong. Cara says, you just reminded me that cookies are done. Yeah, leaky gut syndrome. Rebecca, thank you so much for the 100 stars. I really appreciate that. Thank you, Cara, for 50 stars. I really appreciate that. Thank you so much for supporting our work here. Every little bit counts. Every little bit counts. All right, guys, last call for questions. Last call for questions. I'm going to be giving away gift baskets for IC patients. If you're interested in getting a gift basket, you need to send me your mailing address, icnetwork@mac.com. I'm doing 2 every week, and it's random. There you go. If you're interested in a gift basket that might have some supplements, it might have all sorts of different things in it, let me know. That is my gift to you guys, because frankly, we all need a helping hand right now. Teresa says, what are the bladder builder reviews for patients? So Teresa, on our website, you can find a blog where we just did our 1-year follow-up study, and the data was absolutely fantastic. We were thrilled. So 60% of the patients who started Bladder Builder kept using it. 40% stopped. The ones who stopped because they couldn't afford it. Number 1. Number 2, their doctor wanted them to do something else. Or number 3, that they were having a gut side effect, which is the common side effect that happens with any chondroitin-based supplement. You never want to take a supplement on an empty stomach before you go to bed. That's classic stomach upset at night. Yeah, taking it at dinner time with food is important. For the 60% who stayed on Bladder Builder, what happened is exactly what we expected. Over 20% were now pain-free using Bladder Builder. Patients reported shorter flares. Instead of 5 days, it was 2 days. Less frequent flares. Instead of having a flare a week, they might have been having a flare a month or a flare every 2 months. And less painful flares. And that's the most exciting part of it. And that's what we expected. That's why Bladder Builder is so promising, is because it has PEA in it for pain reduction. And that's exactly what we were expecting. And look at the light just changed here. Look at blue light, or white light, orange light. I don't know. There we go. That's a little bit better. Got the sun shining in. Hello, Brooke. Nice to see you. We've been doing this now for about 3.5 hours, so we're getting close to being done. All right, I'm going to give you your homework. Y'all have homework. This is good, normal, healthy homework. Number 1, I need you to do for 15 minutes a day. I need you to do something that would nurture your spirit. Whatever gives you comfort spiritually, whether it is reading poems, watching a church service, going out and sitting in the sun in your garden, something where you can just sit and breathe and feel peace. For 15 minutes a day, I need you to do something for your knowledge. I want every single person to be able to have the facts at hand. So when you're working with a doctor who doesn't get it, like earlier, a doctor said the only treatment was Elmeron. I told that patient, print out the AUA guidelines, hand it to him. But you need to read the AUA guidelines so that you know the options, because in many cases, you will be the educator. For 15 minutes a day, I need you to do something for your bladder or your muscles or your nerves. So for 15 minutes a day, do your physical therapy if you have that, do a guided relaxation, do the little exercise we did when we started this meeting, or just do that simple bumblebee breathing technique, which will help calm and wind down your nervous system. So the bumblebee, just to remind you, the bumblebee means We want more breath out than going in. So we're going to do deep breath. And then you can either make a buzzing sound, like something like that, or sing. So deep breath. And then we wish you a Merry Christmas. We wish you a Merry Christmas. We wish you a Merry Christmas. I'm going to cough. I can't do that, man. My throat's dry. I've been talking too much to sing, but you know what I mean. Hello, left tonsil, dry. And last but not least, as my eyes are watering, for 15 minutes a day, I need you to laugh. Pain that is accompanied by laughter will be minimized. So please, I'm not crying, guys. I'm not crying. It's just I was coughing. I need you to laugh every single day. Watch TikTok, watch videos, watch funny movies, anything at all like that. Let's get some laughter back in your home, laughter back in your heart. Do not sit in your room suffering in silence at home alone with the drapes closed. For God's sake, get out of bed if you can. Open the sunshine, open the drapes, let the sunshine in, turn on some of your favorite music, and let's get some happy juices flowing through. We're talking about winding down a nervous system. Work on your anxiety management, stop sign, deep breath, minimize the thought. We want to try to address any anxiety that's going on too. I do not want you catastrophizing or ruminating. There is hope. The most important thing you should get from me right now is that we have learned so much about this. This is not like I see 20 years ago. We have promising data. We now have subtypes. Some patients are being cured because they have muscle issues or fibroid tumor issues or things like that. They could have pelvic congestion syndrome, which is curable. And for those of us where there are genetics at play, we have promising new inroads there. We're going to be doing quite a bit of work on this in the next year. I'm really, really excited about this. It's amazing what we're seeing. Rebecca says, I have one last question if I can ask. I have a really great job that I love, but since my urgency is getting worse, I take up to 5 bathroom breaks in an 8-hour day. I'm worried my boss is going to notice soon. What should I do? Should I get a medical form if she doesn't understand my disease? Well, number one, you have the right to go to the bathroom whenever you need to go to the bathroom. What makes it challenging is if you're on a production line. If you're on a production line, then basically your supervisor has to get somebody to fill in your spot so that the production line doesn't stop because you're in the bathroom. But if you're working in an office or in a bank or anything at all like that, you should be able to use the restroom whenever you need to. And that's what U.S. law says. And the thing about we IC patients is we're quick. We're not normally in the bathroom for 10 minutes. We can get in and out in 45 seconds. We just need to pee it out. And once it's out, we're back until we need to go back again. Rebecca, what you want to do is you want to check your personnel guidelines and look at their policies for disability. They're not required to know any personal details. You don't have to tell them anything, but that also gets really challenging. And a lot of it just has to do with your relationship with your boss. If this is somebody that you trust and that you've worked with well, you can say, you know what, I'm just having some bladder issues and I just got to get up and pee a little bit more. And usually that's not a problem, especially if if you've missed a little bit of work, half an hour work, if you can stay late to do that work, then it's a win-win for you and for them. You're still getting your work done. Yeah, you just have to pee more. It's no biggie. I mean, think about it. Almost every guy, once he's over the age of 40, is going to start noticing the same issue because they're going to start having some prostate issues. But if they're persnickety about it, like we had one patient who worked in Texas for JCPenney, and she needed to use a restroom, and her supervisor told her to wear a diaper and pee in the diaper as she was standing at the cash register. And that was an egregious violation of her dignity and her rights under the JCPenney personnel guidelines. And so if your supervisor starts giving you problems, go check. You can potentially check with any personnel staff if you work for a bigger company and ask them what your options are. Their job is to, accommodate you. If you're capable of doing the work and it's not interfering with the functions of the business, then they should not fire you. If they fire you for a health-related issue and you can prove it, that is a wonderful lawsuit waiting to happen, and they should know that. They should know that. You might want to Google Americans with Disabilities Act, ADA. Granted, Donald Trump has weakened it a bit, but it's still there and it's still law. All righty, my friends. I think it's time to call it. It's 4:00 here in California. I will hope and pray that you have a wonderful week. You might see me again on Wednesday, depending upon how things go. Take it easy, stay home, stay safe, wear a mask, protect everybody around you. We are going to get through this. With the light is on at the end of the tunnel with the vaccine, and we just got to ride it out this winter until we get to the point. So probably not until March or April, but we can do it. We can do it. We are doing it. We are going to do it. We're going to do it together and help each other. All right? All right. I'll see you later. Y'all have a good one. You can, if you need to reach me, just go on over to our website, icnetwork.org. And as always, please remember that I don't give medical advice. I'm just giving you foundational information and giving you a kick in the butt, sending you back to your doctor with new questions. That's my goal. That's my job. All right. I'll see you later. Goodbye, Facebook. All right. All right, YouTube. Last call on YouTube. Facebook is shut down. Yep. Facebook is shut down. Any last questions on YouTube? Did I miss anything? Denise, why does milk bother the bladder? The milk should not bother the bladder unless you're lactose intolerant. Deb's asking, any idea how long to see changes? Some people report changes from bladder builder in the first month. Well, Red Bull, seriously, you're drinking Red Bull. You're just, yeah, no, there's nothing good about Red Bull and IC at this point in time. You should not be doing any energy drinks like that, caffeine drinks like that. All right, my friends, I will see you later. Be well.